Ladies and gentlemen, welcome to the Big Fitness Podcast. I'm here with Dr. Carolyn, is it Meister?
Meister.
Carolyn Meister. Thank you so much for coming on the podcast.
Yeah.
It is awesome to have you. We kind of like I guess I came across somebody, Josh Hildebrand. I had him on the podcast. He has nothing but like great things to say about you. He sent your information over. I looked through your stuff and I was like, man, you're crushing. So you're a doctorate in physical therapy. You specialize in video analysis of walking, running, gait, overhead athletes, which I'm wondering what that is. Interested in that. Jumping, cutting. So basically like sports performance, sports movement.
Yep.
Certified in augmented soft tissue mobilization, and you're the owner of Sports Movement, Physio, and Performance.
That's correct.
So why movement? Like what makes you want to learn about movements?
Yeah, great question. And thank you for having me. Movement, I think that was just based in what WashU does. If anybody knows the doctorate program at WashU, it is just big into movement. It's called Movement System Impairments by Shirley Sarman. And we really just look at the arthrokinematics and the way people move, like down to the level of arthrokinematics. So we're looking to see what is rolling and sliding and like, let's say the shoulder, because it's such a big joint of like ball and socket. We're trying to see like how well it's precise in its movements and what muscles or capsule or any other like material that is causing it to kind of come out of alignment or out of that optimal movement.
So what is
Arthrokinematics. Arthrokinematics.
I'm sorry, I'm like just freaking monkey brain. What exactly is that?
Yeah, arthro is joint and kinematics is movement, so joint movement. And obviously like that's how we move.
Yeah, no, absolutely. And you get you're specifically like taking video analysis of people moving. Like why? Yeah. Why did you get into that? When did you start getting into that?
Yeah, so I have been a physical therapist for about 8 years, and during my clinic days, like insurance clinic days, I would always be fascinated with how people were moving, and I did movement analysis that was like it was taught by somebody else outside of like WashU. And it made me go, I really like the way even just walking people are moving. And so I'd be like, do you see what you do here? And I would like show them kind of how they're walking. They'd be like, no, I don't really get it. And so I'd be like, give me your phone. And I would record them on their phone. And then they were just like, oh, I do see it. And they're looking over it with me. And then they would go home and tell their like spouse or whatever. And they were just so excited. And I was like, it's the way that we can like actually visualize what we're doing, and people are just like astonished by how much they can see through video analysis.
Like what's the number one thing you see in people's like movement that's like a dysfunction? What's the number one dysfunction?
Oh,
what do you see most of?
I would say mostly kind of like genu valgum, so like that knee in, everything that we're trying to like over the last 10 years, the fitness has been big into like reducing ACL like injury, that like knee in position. It's supposed to be there, but it's just supposed to be controlled.
And why are people hurting that?
Like why are people doing ACLs or whatever?
Why are people hurting their ACLs so often?
Strength. I mean, like if you think about it, you just think like you have these 14-year-olds, 15-year-olds going into these sports and they're not appropriately like strengthened and understanding of movements, and then they're just getting caught in these like weird positions.
Got you. Like they're going to jumping jungle and they're like playing dodgeball and they just come down on the wrong.
Yeah.
Do you know what jumping jungle is?
No.
Oh my God. Sky Zone?
Okay.
Yeah.
Oh,
okay. That's probably better. Yeah. Jumping jungle, by the way, saying that out loud, that is like from my like childhood. Like there's no way anyone knows about jumping jungle. It's basically just a sky zone that exists in like a small town of like 1,000 people. That was such an awesome place. It was a trampoline house. Anywho, it's like the most dangerous fun you can have. It's just like playing dodgeball on a trampoline court.
The other thing ACLs is like skiing. Think about skiing. You've locked your ankles into a boot, and the next joint up that's going to need to have extra movement because your ankles no longer have movement, they're locked into these boots, is the knee. And so that's why you see a ton of correlation of skiing with ACL tears.
I have a client that has a issue with that exact thing. He tore an ACL and skiing, and he actually finally went back to Breckenridge to tackle that after like 3 years. He finally went back and did it. Here's what's interesting about this, and let me know how you deal with this maybe, because this is interesting. Well, I'll tell a story first. I had a client once that was 46 years old. She tore her ACL when she was 20. She was she was in college. She was playing college volleyball. She hurt her knee. She tore her ACL. She had a limp on that. That was her bad leg. And then 46 years later, she has this terrible limp walking impediment that's caused issues all the way up her side. And she still considered it the bad leg. And she still was super timid to doing anything with that leg, even though like there's the doctor's noted it's totally healed.
Right.
How do you find a way to improve somebody's ACL injury when their mind is like, this is broken for sure and I can't do anything with it?
Well, it's definitely not physical, right? Like you can't change, like they're physically okay, but then it becomes an emotional and a mental thought process. And it becomes like an understanding of where their perceived limitations are in that knee. And you can explore that through movement, absolutely. But it's movement with this idea of like, what are you afraid of? And you're literally just testing them, and you're testing them in different ways. Physically, but you're also asking them more mentally and emotionally, like, does this scare you? And you're trying to put them in kind of compromising positions so that they can finally go, oh, this isn't so scary to me. This isn't my bad leg. But that's not going to happen just by like, go do 100 jumps.
Yeah, because it's basically like progressive desensitization, constantly putting them in a place where like they are feeling like it's going to break.
Right.
That's useful. So, how many days should they do that? Should they do that like every day?
I mean, it's how much they can take, right? I'm not a big numbers person, and that's what my patients will know about me is that, like, I'm going to tell you to do something until fatigue, or maybe until your mind fatigues, or emotionally you break down, and then we have to kind of navigate from there. It's not necessarily for me. It's harder for me. There will be times that numbers are totally acceptable, but sometimes it's harder for me in the clinic to be like, do 15, I understand the 8 through 12 is this, and more than that is this, and power is in these numbers. I get those, but sometimes it has to also encounter the emotional understanding of someone, or the mental understanding of that exercise, or that movement.
Well, it's really interesting to hear you say that you're not big on the numbers, because actually I am not either. I'm more of like a stimulus kind of person. I'm like, look, like things are going to start to respond to you like inducing a stimulus, and if like you're doing it 1 hour out of 24 hours of the day, that's only 4% of the day. And if you're only doing that for 1 hour and 1 day for an entire week, then that's 4% of 1 day. I don't know what the percentage of that is for all 7. I didn't do that math, but it's not a lot.
Right.
So just if you're doing all these, so it's good to hear a physical therapist talk about that, because most of the physical therapists that I talk to are like, oh, it's all got to be super, let's say like you got to have them name SOAP notes down. This is the progress and the reason, and this is the numbers. This is what we're doing, and this is the progress based all on numbers. The reason why they've told me is because the insurance pays for this, and with the insurance paying for it, the insurance has to see. So you do deal with any of that?
No, I'm out of network with insurance. So that allows me to be able to treat people how I need to be able to treat them, which is amazing, because it takes that, like, a great example is like manual therapy, which is like putting our hands on people, actually costs we get returns the least amount. So like, basically it's almost incentivized not to put our hands on people. And so then I go, I don't want to, like, if someone needs to be manipulated a certain way in order for them to be able to move without restriction, then to be able to load the tissue, I'm going to have to put my hands on someone. And I love that, especially like I work with some CrossFit people and they're all just like super tight everywhere. Right. And releasing a lot of that has allowed them to gain a lot of motion in like overhead movements and deeper squats and stuff. And so I think that like it's hard for insurance, like it was always hard to justify like what you were supposed to do with the patient. And even when I was in the clinic, it was hard to be like, I had 3 or 4 people, that I'm trying to juggle in 1 hour. I get to see one-on-one people now. And so I get to see people and really go, what do you need? What are we looking at? And I discuss their goals. I discuss the why. And then I get to kind of build programs and we get to navigate how we want to navigate their care.
Which I think is like probably the most effective way to do it. But like, so 4 people in 1 hour?
Yeah.
Like 15 minutes? Like a session of 15 minutes?
Oh, no. You just have them like, you're just juggling.
They're all just there in the hour.
They're all just there in the hour.
Oh,
and you're just like juggling them. And it's like 2 to 4 people like in the hour in like insurance-based clinics. And gosh, that was so exhausting because me as like a healer and a caregiver, like I want to help you the best I know how. And I was so constrained by the fact that like insurance was paying for it, right? Insurance was telling me how to treat someone. So I was constrained and I felt I had such inner turmoil of how I was being presented as a healer, that like, that's what kind of made me choose to go out on my own.
Dude, it's wild. There's a theme coming from the physical therapists that I've talked to who I've like trained myself here as a personal trainer that say that I'm just going to be a personal trainer.
Yeah.
What do you think the difference is between like one-on-one for an hour with somebody and the four people? Is that like, what is the main difference that allows you to be a healer in the one-on-one?
So I think a big portion of even personal training is about connection. You're building rapport, you're building connection with people, and people are healed by like, this is going to sound crazy, but like they're healed by energy. So if you're connecting with someone, you're sharing that energy with them. And so that person knows that you care for them, that you're riding for them, that you're there for them. I mean, you can think about like the doctor that comes in for 4 minutes and goes, yep, oops, everything looks good, and walks out. Like, you don't feel that they're invested in you as a person and invested in your journey. And I feel like that's the biggest part of the separation is I get to invest myself, and people then in turn invest themselves in their own care and in their own journey because they can see that I'm someone that they can trust.
That is such an important part of this whole thing. This is like when doctors, like physicians, a lot of people give shit to like modern medicine doctors, physicians, and here's my bit on it. I feel like the thing is they've got like 150 people they need to see in 30 minutes. And so like the problem is they can't really do much more than just be like, hey, here's a medication that will seem to work. And I can just see how that would be riddled with issues. And maybe they say, we give them a sheet that says like regular exercise, but like without that relationship building. So how often do you see your clients? Do you see your clients on a weekly basis, a monthly basis? How does your whole structure work when you're working with your patients?
Yeah, so I do want to say about the doctors, by the way.
Oh,
like,
ahead.
I know for a fact, like, one of my best friends or one of my really good friends is a doctor, and you can tell they all, like, just like nurses, like, everyone's getting fed up with the whole, like, insurance and, like, not really getting to treat people the way that they want to treat them. So, like, there is more of a push for people to go outside of insurance and see healthcare providers because you'll only get what you could get insurance versus what you can get outside of insurance, which is just better care. But I typically see people probably once a week. If it's a little bit earlier in their treatment, if they're in more pain, I'll probably see them twice a week. I don't think I ever see people 3 times a week. And that's just a personal preference. I think I educate people enough on their bodies that there's no reason that they can't do those things on their own in the interim from seeing me. And then up to the point where sometimes I'll see people every other week for a while, just for check-ins or something like that. So it's very variable, just based on what someone needs.
Yeah, I feel like the weekly, you got to kind of have like a weekly pulse. I call it the pulse, like with somebody to really like build that relationship, because the relationship that you have with the people you work with is so fucking important. Because like if you have a relationship with them where like you're the doctor, where like you go in and the doctor comes in and it's just like, I'm the doctor, you have to do this thing. Then you're just like, fuck you, doc. Like, I'm not going to do that. And then they just leave and just like, yeah, my doctor's fucking dumb shit. I'm not going to do it. And then it's like, you know what I'm saying? So you don't want to be, you're the partner. And the only way you can be the partner is if you like, they know about you, you know about them. And that takes like, that takes you giving a shit.
Right, connection, right?
You know, like a real connection. How do you build your connection with your patients?
I think a big word that comes around to mind is like authenticity, right? Like I am who I am, and I am me exactly the way I want to be presented to the world. And I think people see that and they feel that. They feel energy can be felt, right? Like they say the highest level of energy is authenticity. And like people can feel that I'm just real. And like I think that helps me to connect with people. And then just naturally, I want to know what people are like. I want to know things about them. Like I love quoting Step Brothers. I love quoting, Wedding Crashers. And like I connect with people on those small things, and then it just builds from there. But like I am weird, and I love how weird I am, but it also like allows other people to just be comfortable being weird too.
So what's the, you've talked a lot about energy. So like I definitely 100% I vibe with this. I don't believe that there's like a good or bad energy. There's like an energy that's being directed like in whichever way you sort of like find a way to harness it and then throw it out in every direction. Where does this come from? This idea of energy, like where does this come from?
Great. I had an eating disorder when I was younger, and I was bulimic for about 8-9 years, and that kind of started my journey of like, I was always so logical. I had to be perfect, right? I'm an athlete, so it's like, I had to be perfect. It was an on-off switch, yet black and white. Everything was yes, no, good or bad, right? And then my business started after I found myself, and I started to become within my own power, and I was like, I'm actually pretty fucking cool, like I am somebody. Like I decided people might actually want to come see me, and one of my really good friends was like, you need to start your own business. And so I started my own business, and it almost like just exploded that thought of like energy and everything of just like, I want to like just give energy to people, and I want people to feel comfortable being exactly who they are, as long as you're not hurting anyone, and the deal. But like it just started to come around, and I was based so much in the physical world, that's that logical, that pragmatic, that I didn't realize that there's another like emotional intelligence piece of me, and I'm a very intuitive person, so a lot of the time like I can feel very much like if someone's irritated, happy, sad, frustrated. And so when someone comes in to like even do physical therapy with me, I'm already feeling their emotions that they have brought in, and I can go, oh, they're frustrated about their care right now. Let's talk about it. And then we have these real conversations about how they're feeling.
Were you always good at like having those conversations? Because I know like those real conversations with your client, like one is just to know, like you have something planned and you're excited that your client's gonna come through that door. We're gonna do that fucking thing. And then they come in and then they come in with like the whole like there's a shadow that goes over the whole room, and you're like, oh shit, and they're just like not having your bullshit, and you're just like, all right, we gotta like switch gears. Like, have you always been good at having that conversation?
No, so I actually got better. Like I actually got care for my eating disorder probably like a year after I started being a physical therapist, and I distinctly remember that somebody was crying and frustrated over like their rehab, because it's totally normal. Everybody goes through like this huge like upward trajectory, and then like for some reason 1 week will just snap people like out of it for a little bit, and then the next week it'll be fine. This patient was in that 1 week of just like frustration or something, and I just remember they were crying, and I was like, I don't know what to do with emotions, because I didn't know what to do with my own emotions. And so I just grabbed the tissue box and put it next to them, and I just like walked away and like waited till they were done, composed themselves, and came back. And I was like, I still remember that. And now thinking, I'm like, if somebody is upset, I'm like, what's going on? I'm like in their face with the tissues. And I'm like, let's talk about this. Like, let's have this conversation. We're going to work through it together.
Yeah. Have you ever made a client cry?
Oh, yeah.
Yeah. Like, how did you deal with that? What did you do that caused them to cry? And then what did you do after they started?
I'm really good at making people cry in not like a mean sense, not like but like in a like realization sense. I like really help to bring the emotions to the top, right? Like a lot of people don't want to feel their emotions. So I'm very much like, let's get those out. Like, let's work through this together. And like, I don't like stray from people's like heavier emotions. And so, yeah, no, I don't have any issues like having people cry and be like, let's talk about it, because I'll cry right in front of my patients. I don't mind. If I'm having a cloudy day, I'll be like, I try not to bring that into the sessions or whatever, but one of my really intuitive like patients was like, I knew that I said, I feel like that I'm upset right now. And she's like, absolutely. I go, let's talk about it. And I just told her where I was right now. And I said, you know what? I feel better just discussing that with you. Let's get to your treatment. Do
you ever, when you are in your sessions, like, do you ever bring your emotions into your session? Or do you, like, if you're dealing with like a bad day, like you wake up in the morning and you like fall down the steps, and just like do one of those sleds down the steps and it just hurts you. Fuck. Like early in the morning, you miss your coffee, you woke up late, and then you and then you get to work, you're having a fucking bad day. Somebody fucking flipped you off on the way to work, you about got in their way. And then you have a session, and that person's coming in, and they know the bubbly you. They're like, "Ooh, the bubbly you's gonna be there." And then you're just like, "Fuck, this person's expecting the bubbly me." What do you do? Do you just like just fucking push that shit down, or do you like set the intention? What do you do?
It depends on the person. If I know that person's not going to rock with the emotions, then I'm going to bubble that up for the moment and like make sure that like I have a good session with them or whatever. If it's someone that is not just in tune with themselves, like I will figure out a way to not present that to them. If it's someone that like I feel comfortable with, that they are comfortable with me in that sense, I will be myself completely. And I have to understand and continue to tell myself like I'm not perfect. And I'm not perfect at bringing perfect emotions in. And I would say 70-80% of the time, I am that bubbly person. I am the fun. I love it too. That's just who I am. And I've tried to be like, maybe I can be the quiet girl in the corner. That's not me. That is not who I am. I was meant to be here to just be like the smiling, effervescent person. But there are sometimes 30, 40, not even 40, but like 20 to 30% of the time that like, I'm not that person, and that's also me too. That is me. It's just like that's not the bubbly me. That's the other me with different emotions.
Yeah, it's really nice to have a career where you can just literally be yourself. Because like if you are constantly, in my mind, I feel like if you are constantly trying to be something different actively, like you probably at work, you should probably get a whole different like job that's probably not the one for you if you've got to like change who you are to do it.
Yeah.
So I fully agree with that. It's like the same way. Like I'm just excited. Look, if you walk through the door, I'm usually yelling at you, scaring you a little bit, like fuck. And like just because I'm excited to see you, like I feel like I'm so grateful that people come in and like I get the opportunity to meet awesome people like you. Like so I'm just like I just want to give you the gifts.
Yeah.
I'm so grateful that you're here. I'm so grateful for the opportunity. Somebody's going to listen to my fucking crazy ass fucking, you know what I mean? With all this stuff. And I would say, I am pretty informal. I am very informal. Like this is who I am on the pod. This is who I am with my clients. This is who I am everywhere I go. Cause I'm just not going to change myself. But that gets me in trouble sometimes. And that's why I fundamentally have to own my own business. I'd be fired from every job I have. They'd fire me every fucking place I go.
I could totally see that.
They're just like, what is he doing? He's not supposed to be doing that. I'm just like, fucking, this is what I want to do right now. So
I can totally see that, by the way. And I love that about you, though, because it just seems like that. I mean, I kind of told you earlier, like your name, Big Fitness. It's because you have a big personality, but I don't even think you decided to do it. It just like naturally happened. But that's exactly what was supposed to happen.
And that's like what I've tried to tell everybody. I'm like, dude, just play your own game. I mean, and dude, your own game is hard too. It's difficult. You can't. it's like even though you're doing exactly what you love to do, it's still difficult, you know? It's still difficult. You still go through the trials. You still go through the failures, you know?
There are still times, and I guarantee you have the same feeling, but like there are times that more often than not, I'm happy with who I am, but there are very small times where something will get me down, or maybe someone will look at me a certain way, and I'll go, am I too much? And like, you're someone that's a big personality, and you're probably, I don't know if you ever resonate with this, but like, am I too much? Like, I am too much for some people, right? And like, you know what I say to them? F those people.
Yeah, fuck that, dude. Yeah. No, I would not muzzle myself. And the answer is yes, all the time.
Yeah.
Like, I'm riddled with self-doubt. I'm riddled with like fear, worry, all these things you don't get away from. I've gotten a lot better at being able to just like let them be there, and it's like, cool, let's get after it. But like, no doubt, I'm like, you know, I'll get into something. It's always like, Jordan's on his thing again. Fuck, he's talking about whatever. And I'm just like, dude, this shit matters. This shit matters. This actually matters. Because I'll get on like a tangent about like AI or something, or like how social media is destroying the world. And like people be like, oh, he's fucking going again. And I'm just like, no, dude, like, and I try to take myself out of those situations, because if somebody's regularly doing that, I'm just like, you know, I really love being high energy. I love being able to just like, and that I transfer that into my client. Yeah. My clients that's what my clients come to me for, that energy. Like their whole day might be, to your point, you know, like, it's like, yeah, it's about fitness. It's about like, we need to get you like to, you know, burn a certain amount of calories, and we need you to like bring in a certain amount of calories. And as long as it's protein, fat, and carbs, and you got to make sure that you're getting this percentage of, like, it's like, what the fuck? What the fuck with all this? Like, dude, it's Deb. She's working 3 jobs. She's divorced. She has like 8 kids. Like, she's trying to do it all herself. The divorce was because the guy, like, you know, like murdered a cat down the road. Now he's in fucking jail. I know I shouldn't have said that. We'll lose all of the people listening. Look, I'm just kidding. But the idea though is like, she's going to the office. She's going to all these different places, and she's just like, everybody in those offices hate their life. So she thinks that like life is just about hating life. And then she comes in here because she's becoming overweight because she's stressed out. And I'm like, fuck Deb, let's go. And me and Deb are fucking getting after it, and we're talking about crazy shit. And like, then she starts getting better because she's like, oh my God, there are people out here that exist that think I can, that believe that I can improve my life. And just that energy, that excitement, the enthusiasm, hey, like, life is good, life is badass, life is exciting, life is adventurous, life has a lot for you no matter what you're doing. They get fucking better that way. They get so much better. They just like, it inspires them to better their own life. And it's like, wow, can you imagine if we could just give that to everybody? And then I do that because that's who I am. And then somebody goes, you know, Jordan, it's 6 a.m. Could you just tune that down, please? And I'm just like, no, I'm not gonna tune that shit down. Fuck that. You take your tuned down, realistic, like, you fucking 6 a.m. ass out of my orbit. You know what I'm saying? It's simple as that.
I love that. I have 2 questions.
Go ahead.
Do you think this lady, right, like, you are the connection that you're having with her, the excitement that you're giving her, how do you think that you're changing her on like a cellular level, or like even hormonal or mental or emotional? Because giving her 10 lunges, you know, is not really like that, you know, changing her to be able to have her lose weight like that.
You know, like, I don't know exactly what it is. Okay, I can't tell you that I know exactly what it is, because
but you like to read into everything. Why haven't you explored this?
Everyone always tells me I think too much. I disagree with these people fundamentally. I don't think enough. I try to think deeper and deeper on all of these things, and you're 100% right.
No, but you think, you don't feel.
No, but so
you try to think deeply.
You gotta think.
What about feeling deeply?
Wait, explain. What do you mean?
Do you know the difference?
Well, I know the difference. Do you really know that? But do we really know what feeling is? But we think and we feel.
Ooh, I love this.
But do we really know, like, what? Like for example, like, how do I know that I feel happiness the same way you feel happiness?
You don't have to. You don't have to. No one says you have to. But if you're always thinking, versus you said it yourself, you're like, sometimes I have self-doubt. That's not a thought. That's a feeling. That's feelings of shame, possibly. That's like, that could be a word that I don't have a word for, right? Feelings can be whatever you want, right? But that's a feeling of like, that something doesn't feel right, but then you go into your thinking and you're like, I'm doubting myself thoughtfully, but like it comes from some other place.
So your question was, I see what you're saying. So your question was, how do I think that experience is changing her on a cellular level?
Yeah, or emotionally, or not, like, not physically, like burn calories, less calories, that kind of thing. Your interaction with her, how is that changing her life?
So basically what is happening at a cellular level with like having somebody believe they can do it based on like, hey, this person is in here who's like saying, let's get after it. That is an interesting question. I've never been asked that before. I haven't been asked like many questions on the podcast, which is good. It's a nice change up. So way to get after it.
But I'm that lady, right? I'm the crazy girl. And also, question number 2.
Well, wait. Let me finish.
Oh, okay.
I do want to like have a bit on that. It's kind of like placebo works 60% of the time, kind of thing. Why does placebo work?
Because there's so many more factors that aren't into studies, right? We can only control for so many factors, but you don't control for emotions. You don't control for like thoughts even, right?
And what
makes it placebo?
For example, like if you like affirmations, are you big on affirmations at all?
Sure.
So like
I'm not big on everything. Like I don't drink Kool-Aid.
Do you think like affirmations work? Like just saying like I am a thing before?
Absolutely.
So like that, but like if you are not actually that yet, like let's say winning starts based on like you just start believing right now you're a winner. Like right now, I am a winner. Even though like you're losing bad. And it's like everyone can see, you can even see you losing bad, but you just like, I'm a winner. You start to like.
Can you do it without feeling it though? That's the question.
It's got to be
affirmations.
Connected.
You could say, I am a winner, but if it's not how you actually feel, then it's not ever going to happen.
And that is 100% the point. So like with these affirmations have to be paired with strong emotions.
Yeah.
So otherwise affirmations are worthless. If you are saying like I'm a winner, but like to your point, like your emotion is, dude, you're fucking lying.
We're going to get Jordan a feel big.
So
feel big,
dude.
Feel big. Feel big. Live better.
Dude, I think these podcasts, Trey, are starting to become like training sessions for Jordan. You know what I'm saying? But no. But what is that? So I totally agree. I agree with what you're saying. So you're saying that the feeling is what we need. It's not the thought. It's the feeling first.
It's both.
How do you
That's like two brains, right? If you want to think about it as a brain, your heart is a brain. It's just not. Your brain is an organ, your heart is an organ, but they do separate things, thinking and feeling, which you need both in order to do action.
So, 100%. So, how does one navigate like getting somebody that emotion, sending that emotion, that feeling, so that they can believe?
Well, that is really hard. That's like part of manifestation or affirmations, right? Like to feel something before it's even happened is really, really hard because feelings are sometimes responses of things, right? A traumatic response, this is how you feel, and it kind of can get trapped in your body in some ways. That's why we experience pain. But like, again, feelings can sometimes be reactive. That's a proactive desire. That's really hard to accomplish.
Yeah. And to your point before, like I do, like the get Jordan to feel big, live better. I don't even remember the last time I actually like cried. I don't remember. When you were saying like, we'll cry it out. We'll start the session with a good cry. I just have been like powering through business.
Yeah.
And just went with this guy, Sam Schaefer. Dope dude. He has an ice plunge. Like I want to get some ice plunges in the new gym, so I'm looking for like which ones I should go with. And he was like, dude, come to my crib. I got one in the back. Like he's sponsored by I forget which one it is, but it's basically the ones that are in like big giant Yeti coolers, basically.
Yeah.
Anywho, I was like, let's go get after it. And I've done 53 degrees in an ice bath, but that one was 42 degrees. And dude, 3 minutes and 42 degrees, you'll jump in there and meet the Lord, dude. You know what I'm saying?
I love that.
But when you get in there, the whole idea, this was the weird part. was that like you get in there, right? And like you're for 3 minutes, you know, he's coaching me through this because I've done 15 minutes, and if you can do 15 minutes in an ice bath, you haven't done an ice bath, you know.
Right.
It's 3 minutes, and
Right.
this is the first time I've done it. So he's like, dude, like, I'm all tensing and everything, and he's like, look at your face and shit. Your face is all fucked up. You gotta change this up, you know? No, I'm just kidding. No, he said he coached me through. It was really good. So breathing technique, it's like you don't muscle. Here's the interesting part, the profound part, I think, is that you don't muscle through this. You don't like, you know, with all the grit and all the cuts and the scars and the fucking everything, you don't muscle your way through it. You submit to it. You you allow it to be. You breathe, you relax, you let it go.
You are increasing your parasympathetic nervous system, right?
100%.
Yeah, because you're in this fight or flight and you're trying to learn how to relax, let go, be in your parasympathetic.
In 3 minutes, I think like the last 30 years of my life was just like left in that little bucket. I was like, damn, dude. I was like getting out of a suit. Like I just came out of like one of those onesies. When I came out, and I was like, man, fuck yeah. That's what I'm talking about. What do you think that is, man?
Oh, that's just like your realization, right? That's like your aha moment a little bit. Like, think about it like I cry, and I don't have an issue with crying. And I cry to release emotions and release the energy. Recently, like say someone yells at me, and I'm just getting this like energy that's just like angry and frustration and stuff. And I get angry and I go into this like tensiveness, right? My way, my personal way, it's not the way everyone has to do it, but my way is to cry. I cry when I'm angry because it releases those emotions. It releases the energy. For me, there is this big thing, Dr. Peter Levine, he does somatic experiencing, and it's about that things get trapped. Experiences, emotions, pain gets trapped in the body because we don't release it. And he talks about like a gazelle getting chased by a tiger. And the gazelle, after it's done, because it's been through the fight or flight, right? It's gotta flight, right? It's gotta go because it's not gonna fight the tiger. After it, you can see it's like kicking and like sprawling and everything because it has to release that energy, that sympathetic, that adrenaline. So my question for you is like, how do you release the adrenaline? How do you release the sympathetic?
Oh man, how do I release the sympathetic?
Yeah, how do you release that energy that you, when you're angry, when you're shameful, when you feel these big emotions, do you just shove it down deep?
No, dude, no. I do like a solo podcast and I just like cuss a bunch. No, I'm just kidding. I don't do that. Well, maybe I have done that a handful of times. We just like, I'll get off the rails. Well, I'm an ultra endurance athlete. So like my number, just so that when we get into gait, I want to talk about running and like how that affects you.
What are you running from?
But no, running towards. See, this is this is the refront, running towards. 100%. By the way, 100%, Trey. 100%. Look, running towards.
Okay.
So I'm running towards. Believe me, I'm running towards. Because I've thought about this deeply because I've spent a lot of time with myself out running.
Thinking, not feeling.
No, feeling. I think feeling.
I've thought about this a lot. That's what you just said.
Oh, my God. Well, okay. I've been feeling lately.
Oh, my God.
All
I
sorts
love
of great things.
We're going to turn you into a feeler.
Dude, this is my problem. This is fundamentally my problem. I should be way more. I'm telling you, I should be, because like at the end of the day, like I really am just like a person that's like, look, here's the data.
Yes.
And it's like, but that's so interesting because you would think this is the other way around. This is actually interesting because you would think this is the other way around. You would think that because you're a doctorate, that you would basically be the one who's like, look, Jordan, don't be fucking weird.
Yep.
Like there's numbers. And then I'm the one who's just like the layman in here in this place, the layman, without the degree. Like I just like bring people in and say like, dude, let's do some jump rope. Actually, we'd never do jump rope. We have a jump rope, but we don't do it. But in any case, like I bring them in and we're like, I'm kind of somebody who's like, we need to induce the stimulus.
Yes.
We need to like be like high energy. We need to connect emotions with our vision. So it has to be very emotional. You have to be clear on what you want, and you have to have an emotion that's powerful enough that when you don't want to do it, you still do it based on your vision. So clarity of vision connected to your endurance, like on your way to your goal. Anywho, that's like me. So you would think that like I'm the one who's like meditating, but it really isn't, dude. I go hard. So I can explain to you like real quick why this is feely. This is gonna be feely for me.
This is the best part. Go ahead.
This is gonna be feely for me. So I am an ultra endurance athlete because I push to see what's possible. I think that's awesome, and I try to figure out what it is that you really get. I mean, if you've ever just like ran a 24-hour race, I mean, you're just nonstop running.
Yet nobody sane does that.
No, dude. Yes,
I'm just kidding. I'm kidding.
Yes, they do. I'm telling you right now. Dude, I think like, you're running around for 100 miles. You start to really think you start to pick apart and understand the architecture of your mind. So very much thinking.
Okay.
But the thing is the things that you care about, like emotionally, the things that you emotionally care about are the only things that are left from all the bullshit. Like,
right.
Like with all of this information that comes in on a daily basis, like million things just coming through. You're on your phone. People are spending like 4 hours on their phone per day. Like that's like the average. This is insane. So, and it's like all short form, 15 seconds. Like how many videos did you just absorb? Like how many different people's lives? How many people did you compare yourself to? How many people, X, Y, Z? Like we're stuck to these screens. It's like you almost can't operate without them. So like you don't know what's important. You live in this like consistent, nonstop, perpetual what is it called? FOMO? Fear of missing out?
Yeah.
You live in this thing because there's infinite options out there. It's the Paradox of Choice is a great book. It talks about why there's so many people out there that are fucked up because like there's infinite options. So no matter what option you go with, it's always not going to be good enough. So you're always going to be measuring yourself up to what you aren't and what you could have been.
Right.
And so in my mind, when I'm out there, it melts away all the shit that doesn't have any emotional pull on me. I think this is important. You think a nice car is important until you run 100 miles and that car doesn't matter. Mm-hmm. You think that it's important that everyone cares about what you think it's important to do all sorts of stuff because of everybody's opinion of you, and everybody's opinion of you doesn't melts away. It has zero. It does not have enough emotional power. It does not have enough soul power to put one foot in front of the next, and you start to understand the things that truly matter to you. Clarity is unbelievable because the only thing that will get you to put another foot in front of the other is the thing that you truly care about. And it's interesting what happens. It's very interesting what happens, and there's this point at 12 hours where you start to hallucinate and lose your mind and go insane.
Ooh,
I'm just kidding. But you do hallucinate. It scares you a little bit. You're like, man, this is probably my body saying like we're gonna die. And you push past that, you don't listen to those voices, and then after you push past this weird thing where these voices in your head stop talking, it's like the only voice that talks is the voice that is like closest to what you really are in essence. It's like the voice that has the only power to keep you moving forward, and it talks to you in a way that just it puts a chill down my back. Now that's why I would say to do an ultra marathon run, because like it automatically gets rid of all the bullshit that like you think matters, and that's caused you to be lost, quote unquote. Automated way to do it. Set the intention first, though. It is important. Set the intention first. I'm doing this for betterment. So that's that. But why am I running right now? Like literally already ran 6 miles today.
You could just get high.
Well, look, we'll get to that.
Right?
We'll get to that. That's a good point. That's
runner's high is the same.
That's a good point. So like
you just worked hard at it.
Right. I don't know. I'm telling you, there's something to it. But in any case, the reason why is I'm gonna do so. My mother-in-law, basically, she's gotten an aggressive bone cancer.
Okay.
And so it's been rough for them financially. So my thing was like, why don't we do a benefit? I'll run 200 miles in under 48 hours.
Okay.
As like a way to. So now I'm running like 125 miles. I got a 130 mile run in April, at the end of April, but it's just kind of like to get myself to the point where I can run 200 miles. By the way, I'm meeting with somebody this weekend. His name is Cody Schiffbau. This guy just ran 250 miles in a called the Queenie Backyard. This is basically 1 mile at a time. Mile at a time. Oh, actually, I think this one was 2.5 miles at a time. But that's connected to feeling, I'd say. Don't you think?
How? You said clarity, but then you were talking about clarity of thoughts. It's because you can control your thoughts. You can't control your emotions. I can see where you
I see what you're saying. It's like
you're like, wait, did I do it? Did I get it right?
No, there's no. Is there such thing as the right?
Oh don't know.
Is there such a thing?
No, that's just that's how you understand things right now.
Yeah.
And like, I think it's really cool, but I also think there's a sense of control around thoughts, right? Like everyone, you can control your thoughts more than like, you can't even control your emotions. They just are.
Yeah.
And like, that's harder to do. And I challenge you to tap in.
I think I'm going to tap in. I think
not running and exhausting yourself physically. Tap in where you have the most energy, like when you are not exhausted from running.
So what gave you this perspective? What's given you this perspective? Explain to me that. Because like this perspective that like this is not a physical thing. And I agree with this.
Yeah.
But let's say
I mean, it's everything though. Like, it's not just all physical. It's not all just logical. It's not all just feelings, right? We're just talking about that because you have the think down perfectly. You have thought down pat. But that doesn't mean that that's everything, right? And I don't have everything all this thought out and everything, but like I had to go to school for the thought, right? Studies, and I got my doctorate and everything, and then I was like, okay, what's next? And then I like dealt with my emotions through my eating disorder, and then I was like, okay, what's next? And then I kind of tapped into like the spiritual world a little bit, and I'm like, okay, this is kind of interesting, and I think all of it just makes us who we are, and is different from the way you think and I think is just, and there's no right answer, like you said, but I'm just on a different journey.
If you can't, no doubt. That's why I say I'm a fundamental believer in the philosophy, Socrates' philosophy, that basically the only thing a human being can truly know is that they truly don't know. They never will.
Yes.
And so, like, I believe that. I do believe that. So most of what I say is just like, anecdotes of my human experience.
Yeah. Well, you're trying to know, aren't we all? We're trying to have knowledge in something.
Yeah. Well, look, it's becoming a trend that like I'm not a feeler, I'm only a thinker in the past couple podcasts. So like, a couple times it becomes trend.
Maybe you got to go inward. You got to go inward.
Well, like this would be like, and I'm telling you, like this is no doubt the case. This is no doubt the case.
You're like, I'm not denying it.
Well, that was I'm done. Literally say like that's why I was telling somebody before we even get in the new gym, I just kind of want to get an ice bath in here, do one every day.
But that's still a stimulus. That's still a stimulus. That's still a fight or flight stimulus. How do you slow down with not being stimulated?
I guess just breathing practice.
Do you do that?
I do.
Okay.
It's like the only reason why I'm still alive, I think, today is just like breathing practice. I used to have such bad anxiety attacks.
There you go.
So here's something that's interesting. Like, I know this is not my podcast. This is your podcast. I have to ask you questions. You're supposed to answer my questions.
I'm sorry.
Dude, like, Carolyn, you're the
people want to get to know you, though. You're the podcast host.
No. They do.
I am just merely a mirror and a reflection of you.
They're learning a bunch about me.
But they're learning. But they're learning a lot about me from what I'm asking you.
No doubt. That's exactly right. That's exactly right.
So who's the teacher
I
here?
have great. That's what I'm saying. I have had a bunch of coaches on here. The whole idea is to bring on coaches who are really good, and so this usually turns into a free coaching session for Jordan. So I'm like, which I love because it's like that's how I like all these different things I've learned like over the past doing this podcast the last like 4 years have a lot of it, not most of it, but a lot of it has been researching the people who have on my podcast.
Yeah.
Because I'm genuinely interested in things about you. But in me being genuinely interested about a coach who's really good at coaching, the coach is like then interested in me. So
well, and I've always dabbled about thinking about a podcast myself because I do love connecting with people. 100%. And I love to just hear what people have to say. It's that intuitive thing too. Like I can read into your answers. I look at conversations as little threads, and I can pull on each little thread. You said you're an ultra marathoner, and you said you have panic attacks. Like I can pull on.
I didn't finish that.
Yeah, I can pull on every single thread. But I don't, right? But I see all of them there. Yeah. And like, I just find that so interesting. So like, you're a podcast host, but like I think it's really cool what you get to do, truthfully, what you get to do, because you get to just hear what other people have to say. And in turn, you're just learning more. about other people's experiences, but then also like in the fitness world and everything. And I think that's so cool.
Well, there's no doubt, we'll say this, there's no doubt you're right. Here's my about like the whole like feeling thinking thing. There's absolutely no doubt about that. So like it's not something I haven't been aware of. I've always been somebody who has been aware, like hyper aware of myself and like the things that I'm dealing with. But what I find interesting is that I know that I have these problems myself and I have a difficulty changing them. So it's like what is it that will cause the change? To your point, it's like there's no stimulus. If you continue to look in the external world for your internal situation, you will not find, and I get it. But what's weird is that like even with knowing, and I mean, this is like, ask Trey, like anybody who knows me will know that like it's monotonous. I'll be blackout drunk and I'll be like, you guys, this is how you win. You gotta do this. You gotta, and it's gonna be, it's like I'll be blackout drunk. This is like the essence of what I am is to try to figure out sort of, because I'm fascinated with it. It really, it gets me out of bed in the morning, man, just to get out and like connect and find people and talk with them. But I still have fucking trouble changing the behaviors, dude. And it's insane. It's like, this is what you're doing. So let me explain real quick. So I came up just to kind of give you an idea. Because you pulled all that out, which is awesome. Great work. Guys, you guys gotta hire this one. But like when I was younger, so I grew up in a kind of a fucked up situation, we'll say.
Yeah.
And I was extremely poor, all the bullshit, gang violence, stuff like that. Good to go. Anywho, I could not talk. I had this social anxiety in a way where like you could come to me all the way until I was a freshman in high school. Yeah. Or like I could not open my mouth. You'd come to me and it would be like physically couldn't open my mouth because I felt like whatever was going on, it felt like I wasn't worth the giving you an answer. You're not gonna get, nothing is gonna matter about what I say to you. Ooh. You know what I mean? So opening my mouth, like, so like, just like absolutely, I'm not worth shit. I'm not significant enough to be a part of this. So I'm so afraid of saying anything. Mm-hmm. Then freshman year in college or high school, I was like playing football and I was like, this ain't good. I'm gonna need to figure this one out. This one's not good. And so I joined this drama club, and I'm not going to go on with the story, but the idea with this drama club thing was there was a really awesome exercise where everybody in the drama club, because we were doing plays, we did it on the stage. Everybody got in a circle, and every person went in the middle of the circle as like an exercise to get everybody kind of going, to get them break them out of their shell, right? So everyone's circling you. It's like 20 kids, just staring at you, and everything is completely silent. Like this. And you have to scream to the top of your lungs and jump around and dance like just let all the energy out. Yeah. And I mean, just to the top of your lungs, and nobody could do it. They turn red, locked up, physical lockdown. All right, you can't do it. Back to the circle. Next person. Nobody could do it. All the way around the circle. Get to the beginning of that circle, that where the person started, and he's like, all right, you're up next. You're doing it again. That girl came out, and she just fucking did it. She just let out. And it was like, oh, this is so amazing. Like right there, like you were just able to like do, okay, next person did it. I didn't say this part, I think this is important. There was like the super popular girl in school, senior, put this
attainable,
put
like
this girl
unattainable.
Put this girl on the fucking pedestal as high as the pedestal goes. Right. And she couldn't do it. She was locked up. She was just like everybody else.
Because of her insecurities.
Everybody is fucked up.
Yeah.
That's what it came down to. In one exercise, everybody was able to open up based on take the people off the pedestal. I was able to like use that as like a whole shit, like breakthrough. I've been holding myself back based on the bullshit, and now I can like open up. Now I just talk too much, but like I literally talk so much that like I'm like, you know what? I'm an endurance talker. I might as well put myself on this thing.
Do you hold your self-worth in the amount that you can like think logically and talk logically and like give people insight into like your studies and stuff, like the amount of knowledge that is that around your self-worth?
No, I think that it's to some degree. I think that my experience, I think I've gone through enough. I've endured enough. I have put myself. I have had enough
for
clients.
who?
Like just to have an opinion on this, but I will never, but again, like with the philosophy of like, I will never know enough. You know, like I will never know, not enough. I will never know everything.
Yeah, but you said, I know enough. I am, enough for who?
I guess just enough
for other people.
For the folk.
But not enough for you.
For the folk to listen, I suppose.
Yeah, but you're still struggling with if you're enough.
How does one become enough? How does one change their relationship?
You
with
have
yourself?
Yeah, right. That is the hardest thing. Like there are still moments that I have like insecurities and like a self-worth issues, right? That was the whole reason that I had an eating disorder, because I just thought I was a piece of shit. But I just started saying like, I am charismatic. I'm fun. I'm funny. Like I'm tooting my own horn. To other people, you're like, oh, this girl's just like cocky. And even someone said to me, like, you're confident. And I was like, no, I'm not. And they're like, but you know your insecurities and you're okay with them. And I'm like, well, in that way, I guess I am confident because I do have insecurities, but I'm also okay with them. Like, I'm more emotional than other people are. And like, I'm intuitive, and sometimes that can be exhausting. And like, I can get angry sometimes. I have insecurities, and I could just think, oh, I'm a piece of shit sometimes. But like when I then logically go, am I though? And then I go, no, like I'm so cool. But that's just me accepting myself. And that's the biggest thing is like, I'm not here to make sure Joe Schmo thinks I'm worth it. No, I'm worth it because I know I'm worth it. And I don't care what they think.
Yeah, I don't know if I care what other people think. I think I care a lot about what I think, and I almost never think I'm good enough for sure.
Yeah.
100%.
Yeah.
Like
so you're fighting yourself.
I go hard for that, dude. I go hard for like thinking that there's enough significance out of me. There's no doubt.
Yeah.
And that's like one thing, but again, it's like, it's like just if you don't feel like, okay, this is interesting. So I'm just kind of thinking right now. Too much.
You can think about this. You're going to think about this for a while.
Okay, let's say this because this is interesting. Let's say this. So you don't feel like you're worth, right? Let's not you. Just
yeah. Okay.
People.
I was
let's
like,
just say,
I do.
Not let's just say a person.
Yes.
You don't feel it. Like you really feel. You feel that you're shit, and so you're saying you're shit.
Yes.
You're good to go. Good to go. So that's it. You don't want to get caught up using the external world to shift that way of thinking. Right, correct.
Right. External
so like
validation.
That's right, because then you'll need that. You'll need that thing outside.
Because you're missing it internally.
Yeah. So how does one shift their internal thoughts or their feeling, if not by the external world, let's say?
Right? Like you have to go run. You have to be in an ice bath. This is how you get these like, you finally come to terms with things, or you're able to relax a little bit. Like you just sit with yourself, and maybe you go out in nature and you just sit with yourself and you put your feet in the grass, and like that just helps you kind of just like, you take all other elements out, right? And so it's just you sitting with yourself, and you aren't shameful with what things come up, right? That is really hard for people to do. That is really hard for you not to like reach for your cell phone or do other things, to distract yourself from what am I thinking? What am I feeling? What's going on? And you just let those thoughts go. And that is the intro into self-awareness. Because if we have self-awareness of who we truly are, then we can start accepting who we are. And it just comes from awareness to start.
There's no doubt. I think awareness is key. But how do you create awareness if you're like somebody who's still stuck in the matrix?
Right?
What brings you out of the matrix? Like
I'm not the guru here. I don't have all the answers, and I don't. But something that's worked for me is just being like, over time and time and time again, putting myself in situations and going, no, like I am kind of cool. And like, no, like I want to be who I want to be. And like, at my gym, everyone knows me as the charismatic community, like crazy lady. And sometimes there are times that like someone told me a story and someone would looked at me funny. And like immediately in my gut, I could feel this emotion of like shame, or just kind of like, am I enough? Right? Like, am I too much? Am I too much to these people? And I was like, I don't care what they think. Like, at the end of the day, like, I would do that 10 times over because that is the joy that I felt in the moment to scream at my friend who was trying to do his burpees, you know?
Yeah, 100%. And by the way, you help that person out so much just by yelling at them. It's
I know.
insane how much that actually helps. Like, if you're, like, working out and somebody just goes, fucking let's go. You're just like, yeah, dude.
But I feel this sense of, like, you second-guessing yourself around how big and boisterous you are, where that's just who you are. And, like, I can't wait for you to, like, accept that.
Dude, yeah, me too. I can't wait for that as well. That would make it a lot easier on me.
I know, right?
On a day-to-day basis.
I know.
If I could run half the miles I've been running, dude, just have the same outcome.
Done.
Like, no, I do feel what you're saying. But that is what I'm fascinated with, though, is even with the awareness, you know, it's still difficult. It's a practice. You have to continue to, like, check in with yourself. You got to continue to work on.
But again, you're asking me. I'm an external source.
Yeah.
Ask yourself these questions.
Right. Sit down.
Right?
No, seriously.
You're asking me. I'm external to you.
I actually do agree that, you know, what's harder than running around a 2.5 mile circle for 24 hours is like, would be like to sit in a silent room. You know, like that would be more difficult than doing that physical endeavor.
Yes.
Actually, the physical endeavor would distract you.
You should try it. And know that it's not a forever thing. You don't have to sit in a room by yourself for 24 hours or whatever forever. But like you should try it. You should try it.
24 hour like sit in and like stare at a
That would probably bring you more money for your mother-in-law's like cancer.
You do zero training needed. Zero training. She's onto something, dude. We're gonna have you around a bunch, and like we will fucking get so much further. I'm telling you right now.
People would be like, Jordan sitting by himself in a room, not doing anything. Impossible,
dude. Look,
I'll throw money at that.
Look. If I was gonna sit in a room, actually, I think that would be insane. Would that not be insane? If I'm just gonna sit here and I'm gonna stare at the wall and no headphones, and I just have a camera of a live feed.
Yeah.
Dude,
you would lose your mind.
You would lose your fucking mind. That would be way, way worse than running for 24 hours. Holy shit. That right there is the answer. If you want to find out who you are, sit on a chair and stare at the wall for 24 hours. Oh my gosh. Okay, so any case, let's move forward.
Yes.
Why did you start your own business outside of like the eating disorder that you had?
Yeah.
Outside of that, what is the reason for like taking the jump and starting your own thing and the insurance thing?
Yeah.
Why do that?
Because of this, right? This is the reason. Because I'm weird, right? I jokingly say, like, I'm weird and I'm kooky. And, like, there are parts of me that's not a physical therapist, right? There's parts of me just that are a human being. And I want to be able to treat people the way that I know how to help and heal people and talk to people and connect with others. So this is the reason why. This is exactly where I'm supposed to be.
Dude, when you're working with your patients, in this way of thinking more about feeling, like what percentage is like the exercise implementation and workout program and nutrition, that kind of thing, for the adaptation, and to the feeling, the like working on awareness? Like what would you, if you were to gauge percentage? Because I know this is an insane question. But.
I mean, we're always moving, or I'm like putting my hands on them. Like there's not I mean, I would say maybe 10 minutes of a session that we're like chatting, but it's not just about chatting about feelings or whatever. It's like, okay, how were these exercises implemented, and like, you know, what's been bothering you, what's been painful. So, but as far as the feeling, like it's integrated into the activities. So if I know if someone's feeling great, we're not talking about feelings that day, right? But like if someone's having trouble or something like that, like we're going to integrate, like, how are you feeling? Walk me through how you're feeling while you're doing this exercise. And sometimes that will just encourage people to like look at things differently. That's all I'm trying to do.
Are you familiar with a guy named Joe Dispenza?
Yes.
Like Living the Supernatural.
Yes.
What is it? What is it called? What's one of his books?
I don't know
Living
his
Supernatural.
book. Yeah, but I know. Yeah.
I listened to one of his books, but I think he's interesting. He talks about like healing yourself through meditation.
Yeah.
What do you think about that?
I think that's all the answers, right? Everybody has an answer. And like, I think that's one of the answers. I don't think it's the end all be all, but I also don't think your way is the end all be all. And I don't think my way is the end all be all. But I think we're all trying to do a job here, which is help to heal each other and connect with each other. I'm not going to be the like guru, right? I'm not going to be the biggest star in the room, but I am just going to be someone that like tries to help other people.
100%. And by the way, like, this is literally for the shirt. And so that you can know this is important for the podcast, that shirt. But, like, so better together is the theme because we are better together.
We are better together.
You see there's aliens.
Oh my gosh, there are. I didn't see that.
And the aliens back there are to signify.
Okay.
The aliens on the back of this shirt are to signify that we're all fucking aliens, man.
Yeah.
We're all, but even, and there's little people that are like also rebuilding and stuff. And if you see, it's actually downtown, and the 5 is built. The Roman numeral 5 is built with bricks, and in between the bricks is the mortar, and the mortar is the relationships. And if you build and cultivate true relationships, like you can weather any storm. That's why there's destruction around and stuff.
Yeah.
You can weather any storm and you can rebuild with anything, and the aliens will help. So let them help. So it's like, it's kind of like, instead of being like, we need to like, have like an Independence Day war with the fucking aliens, we can everybody can be cool, and we can all just hang out, chill. And if we do that, we're going to be a lot better.
Do you know 5 is the number of change?
So what is it? Life after 5. What is this?
What?
So you mentioned life after 5. What is this thing you were talking about?
Oh, numerology. Well, but like the 5, right? 5 is usually the number of change and freedom. Like it's like I'm a life path 5, and I'm like a freedom seeker. I'm someone that is independent. I'm like, I don't drink the Kool-Aid, right? Like I integrate everything together, and I'm just like a huge adventurer and huge freedom seeker, and like 5 is the number of change.
5 is the number of change.
Yeah.
That's insane.
Yeah.
Like what? Why is 5 the number? What is this numerology? What does this come from?
The same as like astrology, the same as, like I look at everything as just we're all trying to come to some realization of life, right? And astrology gives us that, and numerology gives us that, and studies give us that, science gives us that, religion, spirituality, right? Like it's all trying to be an explanation of things, and numerology is just another explanation.
Do you know much about astrology?
I know a little.
I feel like there's something. There's probably, okay, this is going to be a lot. This is like less mystical, more like there's got to be some kind of like pragmatic answers, like for some of this stuff.
You and pragmatic, think big.
Oh my gosh,
pragmatic,
look,
weird.
look. There's got to be some kind of. There's something going right with this.
You're never going to be able to figure it out.
No, that's right. Which is insane. All I want to do.
You
is
will go insane if you like try to like. You're like all knowledge knowing, right?
But do you think and that's why I currently am, even on this podcast.
What's your sign?
Oh, it's a Leo.
Of course it is. He even looks like a lion.
Look, I was gonna shave before this.
No, you look like a lion. You are like fire. He's fire. He's like rawr, leadership, lion. He wants to be the center of attention in the room. Live to that potential. That is you, right?
Shit.
Like own that about yourself, that you're a fucking lion.
Oh, damn. I fucking love that, dude. That's fucking killer.
Own
Absolutely.
yourself.
I sort of think about that. I've always had this thing where it's like, if you want to be a lion, but this is more about this is, again, just not feeling. This is like physically doing something to become the thing.
That's okay.
If you want to become a lion, you have to jump in the lion's den when they're hungry. That's the kind of thing that I'll say.
Okay.
What do you think? Still like in that path of...
You're a lion, so it's fine.
Anywho, the reason why I say this is like, dude, it probably has to do with like where the moon is in a certain time.
Well, it is. That's astrology.
And where the gravity change has to do something like during conception, what you say, like that changes where you can actually predict you can predict somebody's, let's say,
you want to have an answer for it. But
yes, I do.
It's like Santa, right? Like you would never believe in Santa because you can't see Santa. Like, is Santa real? Like sometimes you just have to have faith in things, right? You just have to have faith. And like astrology is faith-based, right? You have to have faith that those are the things. And yes, there's explanations or whatever. Do I care what the explanations are? No, I think I just have faith that like, the universe exists and who knows?
And aliens are real. I believe that.
Sure.
I have faith in the aliens, at least.
Okay. Hey, you have faith in aliens. That's something to have faith in.
I'm just kidding. But I always say this. Like, I just think that thinking that aliens exist. I don't know if they exist, but if they do, and I'm not talking about like a
but
fucking
that's a
amoeba.
way that you explain some of these weird things that you've but it's not the aliens, it's the universe. But like that's the way you explain it, is like aliens have to be real because.
Yeah. Well, no, I mean, I don't even know. They don't even have to be real. I just hope that they are. It's a better way of thinking. I don't even know. Like, there could be anything. I just don't want it to be like an amoeba. Like, I don't give a shit about like an amoeba that lives like 700 light years away. Like, I don't care about that. I want to be able to like hang out with them, talk,
Oh my gosh, of course
like,
you do.
And kick it. Like, I want to be able to kick with the aliens. And just like, if you think that, I feel like if you think that way, that's just like a more fun way of thinking. You know what I'm saying?
Yeah.
As opposed to
of
being
course.
like, we're here alone, like in the middle of like infinite, I guess.
Right.
Which is like, what does infinite mean? I don't know. But anywho, like, that's a cool way of thinking. So there are some things, there's a spectrum of like the things that I'll just believe.
I knew that this podcast, before I even got here, I knew this podcast would get into this. But like, I was like, this guy's not really into, like, but I could feel it. I had like an understanding of this is what the podcast would be like. But I was like, I don't know if this guy's into it. He's about thinking. But like, it's so funny that like we ended up going into these like crazy fun things. I'm like, this has to be the craziest podcast like that you've done.
Dude, it's like, I have like a handful of things that I write down here. I look through and I'm just like, whatever. And like, to your point, like I riff off the energy. So if Absolutely. Like you come in with like, we're going to do this is what we're doing. Cause I think that like spontaneity is like really what everything is. There really is no order. There's only like chaos. Things constantly move. Put anything together and it will come apart. There's nothing that's solidified and stayed. Everything moves. It continues to move. And so any process will degrade. Any building will fall.
Does that scare you?
No, it doesn't. I don't really mind.
Then why are you trying to logic everything?
This is fundamentally the problem with my existential understanding of life. Like, is that like I have these two parts of me, which is like Eckhart Tolle of like none of this matters and just sit down on a bench and give her all your shit for the rest of your life and just like do deep breathing and like be present, which is absolutely. But then there's like David Goggins, which is just like, let's fucking break like shit over our head and like, run through fire. And
yes to both of those.
Right.
Yes to both of those.
And it just depends on where I'm at. Like if I'm sitting here like with somebody who is like, man, I run through the fire, then like that side comes out of me. It's like, I just let that sort of come out. Cause that part is me. I'm not going to hold that back,
Yeah.
But then if somebody comes and they're like, look, man, it's all about the energy, man. I'm like, fuck yeah, because that's me too. That's me too, man. Like at the same time.
Is that what I'm portrayed as?
Not
it's
you.
All about the energy,
not you.
Man.
I was actually talking more about like.
I'm just kidding.
I had like what would you call it? Like a yoga dad on once.
Oh, I was just gonna say, are you gonna talk about yoga people?
Yoga dad, yeah, and I love yoga, and I love yoga dad.
But how do you meld the two, right? Because those two exist,
it
right?
Is
that is yes and no. That's black and white. That's bad and good. Whatever you want to say. But how do you integrate and put them on a spectrum? And how do you you are both of those things.
For sure.
But you are also like that is all a part of you. That's all encompassing.
So they say something like the right and left hemisphere of the brain are like always having a conversation, and there's like multiple consciousnesses that are like formed in your brain. This is what like if you've ever heard of the Toltec from like, do you know who Don Miguel Ruiz is? Mm-hmm. So like I love Don Miguel Ruiz's shit, right? And like his stuff is pretty mystical to some degree.
Yeah.
But they talk about the Toltec. You guys can check that out if you want to learn about the Toltec. But basically, it was just civilization made up of these folks that were trying to figure out what this whole thing was about. And like, ooh, what the fuck was I? Why was I talking about? Oh, and he talks about the mitote, the dark room of voices. I can only imagine that the dark room of voices is multiple consciousnesses that are like different parts of you. What do you think?
Yeah.
Or are you one thing? What are you? Because we say like my body, we say like my life. Mm-hmm. But like who is talking when they say my? I mean, I am not my body. I am the observer. Who the fuck is the observer? Paying attention to this person who wants that and this person who wants that.
Yeah, I've heard that before. Like, if you listen to your inner voice, that's a different voice. And I was like, oh, I don't know. So
do we have...
Aren't we all one anyways?
So that's what I'm saying. So is that what you think? Do you kind of believe that
I think
some degree?
Yeah.
To some degree, we're all sort of maybe just like consciousness that's just kind of permeated.
Yeah. Isn't it fun to think like what the possibilities are endless? And sure. Yeah. I think we are one, but like I also see us as individuals, and like that's the beauty of it, is there's such a stark difference. There's that pendulum swing, there's that black and white. That white, we're all one, but black, we are still ourselves. But those two things can exist in the same light, right? It can all exist together. But it takes a linker or a feeler or anybody to split the two and say, we have to be this, we have to be. No, we can be all of it.
So that's interesting. So like if like I'm on here and I'm like, dude, we're gonna fucking go run 100 miles right now. I'm gonna show you what's up. But like I'm also the like let's do it. Like we got we're gonna have a guy, Michael Blue, is gonna be in here running just a meditation on May 16th. So, and if you want to come, it's free. Just come kick it. We're just going to all come here and we're just going to meditate. And he's going to run through the spiritual.
Cool.
So just listen to his podcast. You'll be like, oh shit, okay. Like, so like, that's like the part of me that is very much on that side of things. Yeah. Cause I'm 100% down with that. That is as much a part of me. I came up damn listening to fucking, reggae and, Bob Marley. I had like posters up, like I'm Bob Marley as they come, dude. I'll Bob Marley it up. I'll Bob Marley down the street. I'll Bob Marley in the gym. I'll Bob Marley wherever at.
Right.
But I'll also like throw myself through a wall to see like
Rage.
What's on the other side.
Yeah.
You know?
But isn't that, I mean, think about emotions. There's that calmness, but then there's also that rage. Like we are all of it.
Yeah. Do you think you should you just indulge in all sides? Or should you suppress one side to spend more time on the other? Like, what if you're like, because I don't know the answer to this question. Right. But like, if you're kicking it, I
don't think we should do anything. We would should on ourselves. You know what I'm saying?
Should on ourselves.
We can't should on ourselves. Like, that's what my therapist used to say. Like, stop shoulding on yourself.
Stop shoulding on yourself.
You can do whatever the fuck you want. Be whoever you want.
What if you're multiple people?
Sure. I mean, as long as you're not hurting anyone, right?
Yeah, that's my thing. I feel like I'm like 8 people. There's probably a personality disorder. What do you think, Troy?
I don't think so. I think he's just having an existential crisis.
100%. Dude, that's just my whole existence. It's just fighting. Like,
can you make that as one clip, please, and just put that on there?
Yes, I will. 100%. Write that timeline. No, for sure. Like, this is what I'm saying. Like, there's no chance I could sit here on this side or any side and act like I know or have it figured out or am even close. But I also am in no hurry to get there. I do actually really enjoy, like, all of the shit that I put myself through. I don't do it unless I really enjoy it. That's, like, partly my problem. That causes a lot of mental issues because it's like, I'm ADHD as they come. I think I'm like poster child ADHD. They just put me on the poster for any time they talk about it. And it's
Trey's over there like nodding his head.
And I mean, look, but in any case, it's like, oh fuck, I lost my train of thought. That's literally the ADHD. Yeah, fuck, dude. What are you doing? Anywho,
but you have this sense of like you are trying to reject that about you, or you're trying to say like I think you're trying to say like you're ADHD, you're trying to be like, I don't want to be that person, I don't want to be like,
yeah, for sure,
yeah, no, that's who you are, own it.
Yeah. Do you have anything you deal with like that? Do you have, and like how often does it pop up?
Like
how much does Dr. You and spiritual you?
Oh, all the time, but I let it. Like, I just go flow, friend. Like, I just let myself, like, and sometimes I'm like, this might sound crazy, but, like, I'll bring that in, and, like, I don't mind that. That's the thing is I don't try to fight one off and then fight the other one off. Like, I'm just like, come on in, crazy. Like, you know, come on in, like, doctor, whoever, you know, whatever. So I just, like, let it go, and I think I've accepted that about myself. And that's the only thing is, like, when I'll say, am I too much for these people? I'm saying that because I'm like, I know who I am, but maybe I'm too much for them, and then I'm like, no, I'm not. Like, I am exactly who I need to be, but like, I've accepted that about myself, that I'm a little quirky.
What types of people do you spend most of your time around?
Oh, I try to find quirky people like me, you know? Like, I just try to find people that like don't mind me, and usually those are people that are not very insecure. Those are very secure people. My husband is the most secure person you will ever meet in your life, and I find.
What does your husband do?
He's in like medical. He works for big pharma, okay. But like he's just like a deep soul.
Okay, gotcha.
He really is. And so I just find myself around a lot of secure people, because insecure people are the ones that are the loudest, and like are not the loudest, like vocally loudest sometimes, but like I'm loud and I don't feel very insecure, but it's usually like on my Instagram, I get followers and I get people that like me. And then I also get, usually it's the young men that are the ones that are clapping back about some of the things that I post. And I immediately know it comes from a sense of insecurity. They're insecure about what they've brought to the table, and so they're trying to dim my light. And I just go, oh, that sucks for you, you're insecure, and I just walk away. And so anybody that comes into my life that tries to dim my light, you're not going to be in my life. Because I'm a light that wants to shine. And you can shine with me, and I will gas you up. I will make you shine so freaking bright. I have to wear sunglasses. Look, he's wearing sunglasses. But like, I'm here to I'm here to lift other people for sure. But anybody that tries to bring me down, see you later.
Yeah, because like, what the fuck with that? You know, like what the fuck would somebody saying like, dude, like you suck, you know what I mean? Like that's insane.
Yeah.
That's like crazy. And
it's
it
their
just comes
insecurity.
From a place of like bitterness and
insecure
of themselves.
Absolutely.
And like what they've been doing.
But once you realize that and you see that and you talk to people and you're like, wow, that person was really rude. Whew, they are just like, you know.
You almost feel more bad for them than it is anything.
And you go, that's not the energy I want to be around. And I just walk the other way.
Yeah, dude, it's so funny to me because like, for me, I think everybody is profound and amazing. Like I'll have a client. I think every single client I've ever had, I think is just such an interesting, amazing person. And I could brag about all of them, even though they have all these issues, or maybe they have 100 followers on Instagram. Like I have this thing where I'm like, how many followers do you need on Instagram before you can be right about something, you know, or wrong? I don't know.
Never.
Never. Not the infinite amount. Right. You still can't be. But like, you know, it's like these people. They're just like, you know, they work at they're like a project manager for this thing. They're an executive for this thing. Whatever. They go to the office. They come home. They live a normal life there, and their stories are amazing.
Yeah.
Their trials and their things, their challenges, like their everything, their lifestyles. It's like there's so much nuance and so much difference to every human being that every human being I ever have in front of me, I'm just so grateful to have the experience to communicate and connect with them, to your point.
Yeah. That
like it would be very difficult, very, very difficult for me to talk shit on somebody. Like just naturally. I couldn't be like, man, like they're doing it wrong. Because I have no fucking idea their life, their story, their resources, where they came from, their fucked up parents, their fucked up brothers and sisters, their aunts and uncles, the gang that they had to get out of. Like, I don't know. Yeah. So like for me to spend any energy like, you're doing it wrong is insane to me. Like that's an insane thing. It doesn't even, in my mind, it doesn't even make any sense. And so if I see somebody that I disagree with, I'm just like, I mean, maybe I disagree with what you're doing. I don't know why you're doing it. So like, it's not going to spend zero time on like talking shit. Right. But if you're somebody that maybe most people think is mundane or boring, like, oh, like I only do these types of clients because these types of clients do X, Y, Z. I hate that, by the way. I fully disagree with that, but I get it with the business shit. I'm just saying like, no, dude, this is a fucking human being in front of me. Right. I don't care how many fucking Instagram followers you have. I don't fucking give a shit. You could have 0 Instagram followers, and I will love the fuck out of you and treat you like a human being. And that is fucking, and that's, so it's crazy to me, your point. And I'll bet, you gotta meet this motherfucker. He's crazy. And then you're like, you meet him, and you're just like, what? What was it about this guy? And I'm just like, just ask him something. And then, I don't know. But anywho, you see what I'm saying?
I do.
Do you see what I'm saying? Yeah. So like for me, it's insane, dude. It is insane, and it's definitely, but I still, even with all of that, I still am just like, you know, fuck me, dude.
I know.
It's insane.
I know.
It's insane. What the fuck?
Right?
Dude.
I mean, sometimes, like, I'm not perfect, so sometimes I'll be talking shit or something. You know, like, I'm not a big shit talker, but, like, in those moments, and definitely, I know it's because of insecurities that I have. Or something going on, there's something in my life that I'm, like, missing, or it's a reflection of something that I'm wanting, or something. And so, again, at the end of the day, like, even when I do it, I'm like, oh, I don't feel so good doing this, and I know exactly why. Not always in those moments, but, like, I'm not perfect either, like, and I'm never going to be, but like, I'm going to try my best to do as good as I can while I'm here.
Yeah, dude, being perfect, that would be kind of shitty, right?
Right.
If you're just perfect.
If you're good all the time, you don't know what bad is.
You're right. You kind of need, that's exactly right. You need both. It's the yin and the yang sign, right? You kind of need that. So
Yeah,
to
of
some
course,
degree,
of course.
If you want to say, so with that,
I just said a funny liner though.
What is it? Oh, from what?
No, I just was like saying like, if you're so good all the time, you don't know what bad is, and then I kind of like made this weird face.
Wait, write that down. Write that down.
And then I was like, oh God.
For the vertical short. No, that's awesome. I fucking love that, dude. You're a killer. Thank you for coming on the podcast. This is a good conversation. I love it.
I just sounded so bad.
No, you did, dude. This is what I love about podcasting, really, is that like, and also I almost never have an intention for how a podcast should actually turn out.
Yeah.
Like, because I think that
then you'll shit on yourself.
Right. Well, I do that anyways. That will happen regardless. I'll be like, man, that could have been better. I shouldn't have said that. I said something about aliens. I don't know if you like that.
Don't think one iota, like one little don't think one thing that you said was off. Like that was all meant to be the way that it was. So don't friggin' say anything like I should have done this or I shouldn't have done that.
So the more you let spontaneity, I feel like the more you let spontaneity to do its thing, like the better things become. So I had this conversation with this guy. One of my clients he has this friend who owns this business that's like been super successful. He just bought a private jet for $6 million. We went and talked with him a couple weekends ago. This guy, killer dude, and so nice and unbelievably nice. This guy, he's owned his business for 30 years. Kind of came from nothing, kind of person. So we sit down and he's like, dude, you know, because I'm about to open this new gym. So I was like, and my client, I've been training him for 7 years. He's like, dude, like I've got this guy. He's cool. He's like actually excited to do this. He's never like let's say mentored or given any advice to anybody like his entire he's just over there working on his thing, I guess. But anywho, he said let's meet. So we went to like a fucking Ruby Tuesdays, you know. It was literally like a fucking Ruby Tuesdays, and we had this conversation, dude. And I'm like, okay, this is what I'm going to do and all this shit. And this guy's been super successful. I sat down and met with a lot of people like this because I'm always thinking. So I'm like, what's the right way to do it?
Always thinking.
What's the right way to do it? What's the right way to do it? And he goes, man, look, he's like, I've had a successful business for the last 30 years. I just bought a private jet for $6 million. And I'm just now working on policy and procedure. And I'm like, fuck.
Great.
He just sort of like let it just go. It's like almost like it's just maybe the real answer is, I don't know if this is true, like I said, because this is totally against everything that I've been doing for the past 5 years. But it's like maybe
that's not your answer though. That's his answer. That's not your answer.
But so like I've had a lot of this stuff. So this is the interesting thing, right? So then the CEO of Fit Flavors, like I've met up with her a handful of times. I want to have her on the podcast in the future.
Yeah.
I had her on the podcast and she last minute rescheduled. So like it's going to be more towards spring now. But in any case, long story short, we're going to get into her story. And if you've ever read her book, she has a book out, and she talks about how it's just that, like it comes together. It's almost like you don't try to put it together or you figure it out. You just see that this is the path and you just move towards it. And you hear this a bunch from super successful people, but like, should there not be a solid plan that you're working?
Yeah,
you know?
Right. No, I get exactly what you're saying. And it's like, that's hard. That's really hard to have to like, I don't have the answer for that. But at the same time, I get exactly what you're saying. And I know that it feels like it's like the be still and be silent part. And then also the like get work done, move forward, right? How are you supposed to be present in the moment, right? I'm present with you. I'm connecting with you. But then I'm also having to think about all the things I have to do with my business and all the next things that I got to do. And like, how do you meld the two of them, right? And similar in that way of like, why not just be present for a little bit? And then there are things that you are going to have to, get together, but like constantly thinking of the plan and everything that you have to do all the time is not going to get you there any faster. And they're just kind of saying like, be more present.
Yeah, and I think that there is a dichotomy there. There is like a massive like crazy dichotomy.
Always a dichotomy.
There's always a dichotomy, no doubt. Like you can't go all plan, but you can't go no plan. Like, you gotta like figure out how much plan you need.
And they did.
They did.
I'm guaranteeing that they did, but they also left it up to this is where I'm meant to be. This is what I'm supposed to do. And that is that manifestation, that affirmation, right? That if I feel it first, then it's just going to happen.
So to some degree, you want to take the nuggets from the people you admire, or no? Like, what's your thoughts? Do you have like mentors? Do you have people that you're inspired by?
Yeah.
Who are you inspired by?
Everybody.
Who are you inspired by? Jesus Christ.
Everybody.
You're inspired by everybody?
I mean, yeah.
In what way? Why?
I mean, everyone has a story to tell you. Like you said, everyone is so fucking cool because everybody has a cool story to tell.
F word for
but
emphasis.
Right. But like, I don't have to consume them. I don't have to be them to be me and be successful. But I can take nuggets of understanding of where they've come from and how like vivacious what I get from you is I can still be myself. I can still be vivacious because that is me innately, right? And I can accept that about me. And I'm not going to be the quiet one in the back. I'm going to be the crazy one in the front. And that's okay because that is just me. And you're confirming who I am in this way. But maybe you're not confirming that I need to think more, you know? I don't know. We all get stories and little nuggets from people, but it's like at the end of the day, it just reconfirms who we are.
Yeah.
Because if I'm trying to be more like Susie, I'm not me. That's not who I am. Like sometimes I've done that in the past. I go, that guy's so quiet and he's so cool and collected. Maybe I need to be more like that. And then I do it and I'm like, my body is like shaking. I'm like, I want to get out of this. Like, how do I get out of this? And I'm like, because that's not me. That's not aligning with who I am.
Damn, it's so interesting, like how much like understanding awareness you have of this. Josh Hildebrand, this dude, which like has become like one of my favorite people.
Yeah, he's
like,
really cool.
Basically when he explained like you to me, you kind of blew up on Instagram, which is like a very like, it's very like, you know, like nobody's really watching and then everybody's watching.
Yes.
Kind of feeling.
Yeah.
How did you, and it happened in a relatively short period of time.
Yes.
Like one, just out of curiosity myself. How?
Right.
And then two, how are you dealing with that, like with that whole thing, this whole process now that you really, I mean, this is a little bit different now.
Yeah. One of my friends was like, you had to have bought followers. You had to have bought something. And I was like, please take my Instagram. Like, I have not bought anything. Like, I haven't spent a dime on Instagram because I blew up in less than a year. And I chalk it up to just being aligned with myself. I know that sounds so crazy, but like I am aligned with myself and like I'm like, whoa, people like the videos and we can talk about the logistics of it, right? And it was cool, but I got that idea because I thought this is something I enjoy. I'm super passionate about movement analysis and showing people on video form how they do things differently. So I'm going to throw it out there. And I started doing it and it just like, that's what blew up. But now that it's like 90,000, like I'm kind of tired of it. Like I don't want to do it anymore.
Oh, really?
And it's only been a year. And so I'm struggling. I am mentally struggling with Instagram. And I'm not going to lie. Like I'm not going to like, I get that I have a bunch of followers and blah, blah, blah. But like at the end of the day, like, is that still aligning with me anymore? Because there's even people out there, the haters, that will be like, movement isn't the only thing. And I'm like, I'm not trying to say it is.
We haven't even talked about movement this entire podcast.
But that's the thing is like, I don't think that it is the only thing. It's just one of the ways to help someone and heal someone, and it's explanation of like what's going on physically. But then there's other things. There's mentally and emotionally. But that movement, that physical, is the only thing that is shown up on Instagram right now. And so I'm deciding, do I want to continue with the movement analysis, or do I want to kind of pepper in some like more emotional, mental stuff that like really that I align with, that I'm passionate about now? And I think that's the answer. And even just talking right now, it became the answer.
For sure.
Right?
For sure. 100%.
Yeah, right. It like in this moment became the answer because it is something that aligns with me. Just movement alone doesn't align with me anymore.
So then 100%, I would say that should be what you do, right? I mean, just like what you're saying, it's like if you just do exactly what you are, then like you're going to be best. That's the best possible case scenario for you, regardless. If you just do like play your game, you just play nobody else's but yours.
Yes.
And like if everyone's like worried about like what you're doing, like, hey, like I thought you're supposed to be like making sure that my gait's a certain, it's like, or my hips moving or whatever. It's like, it's like no, dude, we want to talk about also that like there's a human being here. Where it's not just like it's not just like a you know, like a robot that's like we're trying to get to be able to walk a certain way, you know, with balance or whatever. So yeah, no, I would say 100% you should do that. I am shit at Instagram and Facebook, all that shit, and like I have no interest in getting better at it. But I've been told by all of the big influencer people that I've talked to, at least, or in my circle that have been very successful, that like I have to just do it anyways, even though I don't want to do it because I'm fucked. What's your thoughts on that? Because like I belong in the woods. I think I belong in the woods. Just
I don't know if you belong in the woods.
I belong in the woods.
I don't know.
Like living in a treehouse. Like
I get you could live in a
George
treehouse,
of the Jungle or
but
something.
I also think you have something to tell people. I just don't know if you know what it is.
Yeah, we're still in the search.
Yeah.
In the 24-hour.
But once you know it, right? In the run, right? But once you have that, I think that's what the key to it is.
It is the search. It is like it is the for all of us. I feel not just me, but it's like it is something where it's like, what if you're born in a situation where like you don't have the resources to bring awareness to like who you could really be, because like you just didn't have access to that, and then you know, and you feel like you're lost. You feel like you're stuck in something in a world you don't belong in, and it's like there's some it's out there somewhere. Like, it's just interesting. I feel that sometimes.
Yeah.
I feel that like I was born in a world I don't belong.
Yeah.
And I'm constantly in a search for finding like what aligns with like what it is I can do where I feel like I can just truly be who I want to be. And look, I'm not saying to get away from hardship and pain.
No.
Like 100%. I think it's like, I think you're not getting away from pain. You can't have joy, you know, without the opposite. You know,
Correct.
the yin and the yang exist so that we can
Absolutely.
so that we can be happy. There has to be sad. So it's like sad's not bad.
But what if happy isn't the answer? What if neutrality is the answer?
Do you think neutrality might be the answer?
Maybe it is.
Maybe
Maybe there's no push or pull. Maybe there just is, right? I am who I am. That means I'm neutral.
That is an interesting thought.
I mean, just a thought here.
That's closer to the right. That's closer to the right answer, because like trying to figure out like.
I love that he touched his heart and he said that's closer to the right answer. Like, that's confirmation.
Closer to my heart.
Yeah.
I just have to feel that thing is actually beating. So, you know what I mean.
I love it.
But anywho, no, that's a really good point. That's a really good point. I just, I don't know. I think that's probably
knows.
what it is, and nobody knows. And that's what I was saying. That's why I resonate with that. But also, I think, like, again, I don't know if there's a lot of push. And let me think inward here. I don't really think there's a push in me to figure it out tomorrow either.
Yeah.
You know,
you shouldn't.
I love what I'm doing.
That's why we have 80 plus years of life, or 70 to 80 years.
You think that'll increase with like science and AI and shit?
I don't know.
Just get connected to a chip.
Right. I don't know, but there's a reason we live such long lives, and it's because it takes us that long to like figure things out.
Do you think you're on your deathbed and you sort of see a like end picture? Like a all right, I did it right, or I did it wrong, or maybe you come to like an enlightenment, let's say.
I think, okay, if we're going
that
down
there
that,
was no right or wrong.
if we're going down that path, I think there's just acknowledgement. Like, I think when you die, there's just acknowledgement of the things that happen in your life. Just acknowledgement and acceptance. That's all. Like, kind of almost like a picture going, like quickly going through, and it's just like, oh, okay, yeah, that did happen. That's okay. I understand that now. And like, you just see the full picture. That's what I see. But like, again, that also kind of goes into neutrality. Like then everything becomes neutral, because you're like, I just understand. It is what it is.
What do you think?
Why are you asking me all these things? I'm not like the subject matter expert.
I know, but you had all these really awesome things to say. And I'm just kind of thinking, like, what's your thought?
Now you're like, what does
we both
she
are.
think?
I know we're both like, we both are talking about like all this stuff. Like, I'm a personal trainer. Like my job is literally muscle.
It doesn't matter.
Yours is biomechanics. This is the thing about the podcast. It's let's put it this way. Because I know, like, in podcasting in general, there is this thing where it's like, where there's this kind of like lashback right now where it's like, can you talk about can you be on a podcast and talk about something that's not your specialty?
Yeah.
Yeah, I think so. I think 100%.
Yeah.
I think that's like some of the most interesting podcasts are to know the person and not the profession. Like what you want to know about like my degree, you can like look at the letters behind my name, and then you can go like bore yourself to death with all the schooling that I had to do for that, or you can listen to the human being that I am. Right. And if you resonate with that, and you come to me because of that, that will be so much more beneficial for both of us.
But that's why we resonate with each other. We resonate so well with each other is because we're just trying to gain a connection, right? We don't, yes, we care about the accolades and everything, but at the end of the day, like, I want to get to know who you are as a person. And like, if you're going to benefit or be the energy that helps me heal a little, because we're healers and we want to make sure that we're vibrating at the right frequency or have the right energy or the right person for somebody to help heal themselves. So we give people the energy, the vibration to heal themselves, right? They just have to match it. And if they're not willing to match it, they're not going to heal.
So to some degree, do you think to some degree you can not have gone to school at all and be like a killer healer in the area of what me and you do, like with people, you movement, me, crazy guy in a gym? I
don't know about movement, like if I would know as much as I do, but like maybe like I'd be able to talk, like I wouldn't be able to say the right things exactly around movement, but would I still end up being a healer? Yes. Would it look like something different? Could I was a personal trainer or, a nurse or something, like I could be a different type of healer, but was I meant to be a healer? Yes, I was meant to be a healer. Mm-hmm. Like I was meant to help people.
Yeah, I do. And I talk to primarily coaches, so it makes sense.
Yeah.
That's the answer, right? That's the answer.
Yeah, that's always the answer.
Do you think there are some people, that really almost feel, to some degree, I feel that like we all want to help people.
Yeah.
We all get fulfillment from being like a part of the betterment of all, like society, let's say, or the group.
Yeah.
Do you think there are people out there that really don't have that urge? That urge or that feeling?
Maybe.
I don't really care.
Psychopaths.
Right. Almost seems like you have to have something wrong with you to not like want to be.
Right. We can't all be healers. There has to be psychopaths because then healers wouldn't look so cool, right?
Right. That's exactly right. But like
the yin and the yang. Why are you asking the questions if you already know the answer?
I don't know that. I know. I'm
kidding.
I talk in circles. But I do want to talk about this. Yep. I want to talk about the augmented soft tissue mobilization. For all of you that don't know, this is a form of manual therapy used in physical therapy to treat soft tissue dysfunction and promote healing. By the way, this is ChatGPT, so correct me where I'm wrong.
Oh, okay.
It involves the use of specialized tools to apply pressure and friction to the affected area, stimulating the body's natural healing response. Is it like Astym?
Astym.
So
yeah.
Astym.
Yeah.
So Astym is often used to address conditions such as tendinitis, scar tissue buildup, and other soft tissue injuries.
Yes.
People deal with like a tendinitis for like 8 months.
Yeah.
So like, and no, 2 years. It just continues on.
Right.
Inflammation maybe is the case. They do everything and nothing works. Why?
Why what?
Why do they still have this tendinitis? If they're stretching, they're doing the ice, they're running through the movement, but they still have this debilitating pain. Like what is causing that pain to not go away? Why?
That's a great question because there are so many studies on tendinitis and there's so many like logical things on tendinitis. There can also be non-logical things, right? There could be tension other than like there's tension on the tissue and it gets irritated, right? And so you're looking at trying to offload that tension on that tissue so it has time enough to heal and reincorporate and reintegrate into that system of movement, right? So say I have a plantar fasciitis. Well, if I am not offloading that by the arch muscles, the muscles of the arch and the calf, and say I have restricted joint ankle dorsiflexion, so limited ankle mobility, then I'm putting a ton of pressure right on the plantar fascia. And so then it becomes pissed off and it says, okay, hello, I'm hurt. offload me. And so then you start strengthening their arches, you start stretching their calves, and stretching, doing gentle stretching and strengthening, and loading it appropriately. You're going to offload the stressful space. And so that's like the logical, the like physical part of it, that explains kind of tendonitis. That's just this area of breakdown.
Dude, people with plantar fasciitis, fasciitis.
Yeah.
They just like, they get fucked. They like can't run anymore, and they try to like get it. They try to like repair this damage, and it like absolutely never goes away.
And everyone thinks it's stretching. Oh, I stretched. Well, no, that's not the only answer. Like stretching is you're just taking that angry area and you're just pulling it apart, rather than like loading and like unloading that space by loading other spaces, right? By strengthening around it, and then also like kind of allowing it to be offloaded.
Yeah, and this kind of makes sense because I feel like this with like something like tendonitis or something like micro damage that's like not good. Like you have like some kind of micro damage, some kind of micro tear that's like not going away. This pesky fucking little bitch is like in my shoulder and won't go, or like a leg or whatever. But in all seriousness, imagine you're a monkey 20 million years ago, okay? And you fall off the tree.
Pretty sure monkeys weren't around.
What? Just all right. It's like it's one of the descendants of humans. If you believe it, you have to believe in. Sorry. Yeah, pre-con. Let's say evolution.
Let's just say you're a monkey.
Yeah, you're a monkey. Evolution 20,000
sure.
or 20 million years ago. Okay, so like this monkey or whatever. All right, whenever the monkeys were around.
Great. Now, monkeys are here.
Oh my god. I mean, all right, I digress. Okay, we you're on the tree. You fall off the tree.
Yeah.
You break your fucking leg.
Yeah. A lion comes and eats you.
And lion comes and eats you. If you stick around, you break your leg. The lion comes and eats you because you're being a bitch and you won't move, right? Okay. It's just you won't move because you beat a bitch. You're like, oh, this hurts and I don't want to move.
I don't think the monkey's being a bitch.
Oh, the monkey's being a bitch. Dude, the monkey just like is the perceived effort required to move through this fucking thing is just like a million for this monkey. He's just hurt. And the monkey says, fucking, I'm going to stay here. And the saber tooth is like, dude, that monkey's mine. And goes and eats that saber tooth. Good to go. Monkey's dead. But the monkey who falls off the fucking tree breaks the leg. Doesn't break the leg, maybe just like rips the muscle because it wasn't so bad of a fall. This fall wasn't so bad. And so falls down. There we go, right? Like gets like some kind of muscle tear, right? Because like your muscles, they're not meant for this type of fall. But it stands back up and says, look, I'm just going to push this thing to its capability and use pain as my indicator of how far I can push it. Okay. And then like so many monkeys falling off the tree, okay? Later. So many monkeys falling off the tree later, you have like...
I don't think monkeys think like this. They're not like, I'm going to persevere.
No. They're just, this is what I'm saying. It's an automated process. It's kind of like, it's like this. Okay, like if me and you are in the Serengeti...
Well, we're humans, so we have a higher, like...
Well, right, that's what I'm saying. Well,
okay.
So, like, that's why I said
I don't think monkeys go, I'm going to get eaten by a saber tooth or whatever versus...
No, right, that's what I'm saying. They'll get eaten because they broke their leg. Don't you see? So, like, if you fall from the tree... So let me
Do you understand this, Trey?
Yeah. Dude, listen.
No, he does that. Look at his face.
Dude, all right, guys. I got to be clear because this is important. If the monkey falls from the tree, the monkey's not thinking. He's just like, look, I'm going to kick it here until this heals. I'm going to stay off of it.
Okay.
Or like, I'm going to utilize the ice method for recovery because he was like, stay off of it, ice it. Okay. By the way, for all of you that don't know what ice is, that's ice. Ice is ice compression and then elevation, which I think has been totally disproven. For something like, let's say, this like sprain that this fucking monkey got. But the monkey's like, look, I'm going to wait. I'm going to sit here and wait until this thing heals up because I can't move it. Eaten by the saber tooth. But the one that pushes it to its capability, it's not saying like I'm going to, it's not saying like I'm going to push it to my capability. I don't want to get eaten by the saber tooth, but it's just kind of like I got to get up and go, because I'm hungry. I'm like, grab some grapes. So like goes to get the grapes. And he wobbles it, but he's loading it. He's loading it to like what pain threshold he can kind of handle. Not like because he's saying what is the pain threshold, but just this is the pain threshold I can handle. So over time, you can kind of think that that like recovery would come from increasing, from basically loading it, not stretching, because the monkey's not really stretching this.
I get what you're saying is loading tissue is helpful, and that's exactly how I feel. But I also don't think that, like, it's just Darwinism. Like,
that's what I'm saying.
If the monkey falls off the tree and he can't get away fast enough from a lion, it's not thinking I'm gonna like load this. It's just gonna get eaten. And if it's able to get away because and scurry back up the tree before anything else gets him, then it's gonna live until other factors take account.
Until he falls off the tree again.
Sure.
It's a clumsy monkey we're talking about.
So I don't think it really has anything to do with loading. I mean, naturally, yes, animals just load their injuries because they have no other way to do anything, right? Naturally, that if something gets hurt, they just have to persevere. They just have to go through it. And if they don't, then it's Darwinism, right? Something's going to eat them, or they're just going to rot and die, and they won't be able to get to a source of food. But
so it sort of makes sense that like we would heal by
loading.
By loading,
yeah.
By loading, not by like doing these other things. That's sort of like my like very.
That was a very interesting
archaic,
way to get to it.
that's my archaic explanation for like why I don't think you should just like stay off of things. You should work it to its capability, load it. Obviously, you're not gonna like have a sprained ankle and go sprinting,
right?
Because that's gonna make it worse.
But then there's the yin and yang of treatment, right? You got to rest a little bit, but you also got to load it. Absolutely.
So is there no benefit from doing like icing and trying to get the inflammation down using like different types of inflammation? Should I just do like the cortisone shot?
Oh,
and forget about it.
So I talk about that a little bit as like the warning sign in the car, right? You have maybe your engine's going to break down or something, and there's a warning light, and pain is the warning light, right? So if you mask that warning light, if you get a cortisone shot, if you take medication, if you do something that masks that warning light, it's still there. The engine is there's something still wrong with the engine. Just because you've put tape over that warning light and said, "Oh, if I don't look at it, it's not gonna remind me," right?
Right.
Same thing. If I just mask the pain, that's not actually changing the problem underneath it. That's just masking the pain. So I'm not gonna go out and get a cortisone shot. I'm gonna take care of myself by loading and resting. And resting is part of that, right? Yin and yang of the treatment. There is a point that you have to offload it, but then there's also going to be a point where you have to load it again. And that's the beautiful thing about trainers and physical therapists is we have the understanding and the answer of how to load and how to deload and how to, because most people come in and they're like, I don't know what to do. And I was like, first off, listen to your warning lights, right? Listen to the pain. It's trying to tell you something, but then let's work with it. Let's see if we can offload you. And when that pain goes away naturally, and sometimes again, if they're in a lot of pain and we have to mask a little bit to take a break and then come in, I just don't think there's a wrong answer necessarily. But like, again, we want to listen to those check engine lights. We don't want to just mask them and turn them off.
That's interesting because you said that your husband works in Big Pharma. That's also why I named this Big Fitness, because I wanted to be like the Big Fitness, like Big Pharma, Big Tobacco. You know what I'm saying?
Yeah.
Like, check it out.
Yes. Okay.
See what I'm saying?
Yeah.
See what I'm saying?
Yeah.
Anywho, so what is his thoughts on that? Like medications and stuff like that. Does he have any like that kind of like kind of goes into your conversations and gets you thinking?
No,
do you guys ever like butt heads on that?
No. I love my husband, but I don't care what he thinks in that like regard, and he knows that. But he also has no like he works on oncology, so like it's like helping people with cancer.
Yeah.
But like he doesn't have a say in the meeting. Like if you met my husband, you'd be like, this man is the most like secure, wonderful. He's not very opinionated. We don't ever like butt heads ever. He just lets me do my thing, and like I let him do his thing, and we just like I don't know. Like it's pretty cool. I'm pretty lucky, but like no, he doesn't really have a say on it necessarily, but like he also values what I do completely.
Yeah, 100%. Like I love your go with the approach of like more of like the holistic spiritual approach to it, like or whatever. I mean, spiritual kind of makes it sound like you're lighting candles in the
right.
Do you light candles in?
I mean, I like a candle, but no, it doesn't help my therapy or anything. I just think like maybe it could. I don't know, but
you like the bells. Have you ever done that like sound?
Yeah.
Like this?
Oh, I love sound, but I just personally I like vibe with sound, but No, I think just having a holistic approach, I guess, of just like there is a movement piece to it, there's a physical piece to it, but then there's also other factors too.
To fix like a movement impediment, so you've analyzed the movement. Mm-hmm. So like you've analyzed it, like this is what's wrong.
Yeah.
Movement impediments are extremely difficult to fix. Like if it's something that's like biomechanics and they've been doing the same thing so many times, it's like almost like steam printed into their brain that this is how I move.
The path of least resistance.
Is it possible?
Yeah.
For them to correct those?
Yeah.
And if so, how much of their mental state,
right,
they're believing it's possible, this side of it, how much of that plays a part in them like actually, being successful in changing a movement? Because you find out somebody has a movement impediment, at least in my experience. So that person I told you about, the 46-year-old, it took us like 2 years of 3 times a week of doing repetitive movements.
It is repetitive. But your design, like I think your word that you come up with a lot is clarity. You're very much into clarity. And my word I would say is intention. So I always talk about like it's not the exercise, it's the intention. And if you're constantly, so great example is my lovely posture right now. I do not have great posture right now, and my shoulders are forward, and I'm again not afraid to not be perfect, right? And he goes, okay, fine. No, I'm just kidding.
No, I've been like that. No, I've been like this whole,
but
this is like,
right. But I don't mind that I don't have perfect posture. And the way to change that, this is my path of least resistance, right? This right here, this posture is my path of least resistance. When I'm not resisting anything, when I am in my most chill, this is what I do. This is my posture, right? To change my path of least resistance, I have to add, like there's going to be some difficulty, right? I'm going to have to strengthen. I'm going to have to hold my posture up like this. And it's going to, after 2 minutes of sitting like this, I am going to be exhausted. Between my shoulder blades is going to be extremely tired, and I'm going to have to do it every single day. And I'm going to have to work, and I'm going to have to work really hard. I talk about a field, and you think about like a trail through a field. Well, maybe that's not the most efficient way to go through that field. Maybe we need to make a new trail. But in order to make that new trail, you got to stamp down the grass. You got to make sure. And that takes resistance. There's resistance to make that new trail. But once it's made, it's more optimal. You can get there quicker, right? So maybe it's my posture. Once it's there, I breathe easier. I'm, more confident, whatever way you want to like look at the difference. But it does take repetition, and you do have to move through resistance, because right now you're on the path of least resistance, and you have to make a new path of least resistance, which takes time and repetition.
Yeah, sometimes it's like I'll use things, I don't know what the term is for it, but like basically if something's not engaging, I'll just like tap. Or I will have them isolate it in an exercise to be like, this is the muscle, like where you have no choice but to isolate and feel that burnout. And then you can see that move. They get like, okay, now I can actually feel this. So it's, to some degree, without like, because you can cue these people for fucking days. Like you can have somebody for like 2 years and do the same cue like every single time they come in. They just never get it. To some degree, I'm just kidding, but like you give these cues, and if you give a cue to somebody you just met and they don't quite, they maybe understand what you're saying. Yeah. You might see somebody get frustrated, and maybe you have had some kind of experience with this, because they're like, oh, I'm trying to do that. Like, bring those hips forward. Like, what the fuck are you talking about? Like, I have no idea how to do that. And it's like, whoa. Like, that is like a blind spot in like their like brain to muscle connection. So it's like, to some degree, you almost have to put them through resistance, like some kind of load, and get them to fatigue somewhere where they feel it, in order to like shine light on that. Yeah, I think therapy can be isolation, right? You're isolating that exercise, you're isolating that movement or that muscle, and then integrating it. You're integrating it into the functional, right? So maybe I do rows to help my mid-trap get a little bit shorter so that my posture looks better, but then I'm holding my posture and I'm working on that. So that's an integrative or a functional movement, which is directly related to posture. So isolation and integration exercises are very helpful in both ways. I always think like, so, we always like, hey, go exercise, whatever gets you fucking going, whatever lights your fucking fire, gets you out of bed in the morning, like, hey, knock it out. Let's say somebody goes into the gym, they work out every day for like an hour, and they didn't have any movement impediments, and they think they're doing what's good for them, but they're like doing like the same, they're like exercising in one plane, you know what I mean? And they just do it over and over and over and over until eventually it's like everything is just shoulders down, pitch to shoulder, chest up.
Yeah. Yes.
You know what I mean? Because of all of these exercises that they're doing.
Right.
Is there like did that fuck you up? Should you not only be doing like,
right?
You know?
That's the fun part.
Jesus.
Yeah. Everyone is like, there's not a perfect person. We do all have asymmetries, and it's working within your asymmetries to make sure that you're optimal, because you're different than I am. So there's not going to be a perfect person. There's not going to be a perfect way to move. It's just optimal towards your body. And there are, just like everything else, there are small guidelines that all of us kind of fit under, because we all have 2 arms and 2 legs and a torso, right? So there is some stuff that's a little less specific. And then there is more specific towards people that maybe they broke their arm when they were little and they have scar tissue, and we're just working around what we can, because there's restorative therapy and there's compensative therapy. So we're going to try to restore as much as we possibly can, right? If you're weak, we're restoring that muscle to strength. But if you don't have a leg, I'm not going to restore your leg. Like, it's amputated. It's gone.
Right.
Right? So I have to compensate around what is lost. And we have to try to, again, restore as much as we can. And then we have to also figure out, what are we compensating for? What is lost that we just probably won't ever get back, or we just won't change, because nothing is perfect. And it's knowing that recipe.
If you have an imbalance, like if you see that somebody's like, let's say squatting, and you see like the hip like sort of like swivels on the way up because let's say they're overcompensating one side or the other with their glute on the way up.
Yeah.
What is the way that you would go about, and it's like, let's just say like bad, like what is the way that you would like balance that out?
Yeah, I would just, like, if they were in person, I would definitely, like, take the time to, like, ask them questions, see what their injury was, then get them on the table, like, see what their mobility is, you know, making sure that, like, I have a clear understanding of what's going on here. And if I don't get to, sometimes I'll do virtual stuff, so it's like, I'll be like, put yourself in this position, put yourself in that position, so I can see clearly what's going on. And I just ask them subjectively, like, have you had any injuries? Talk to me about this hip. Talk to me about the other hip, you know. And so then I just guide them, and it's a trial and error. Everything is trial and error. Science is trial and error. So, like, all of it is trial and error. So I just go, okay, try this. Oh God, that looked like terrible. Okay, try this one. Okay, try that. Nope, definitely not that one. Like, you know, so we're just
100%.
like, we're just figuring it out.
It's so funny because people they kind of want to feel, they kind of want to, you know, they kind of, like, you go to the doctor,
Yeah.
you kind of think, I'm like, I have these issues, they'll figure it out. There's like a plan for this.
Right.
I always like to tell people it's a medical practice. So it's the same thing. It's like when you have somebody in here, it's not one size fits all. It's like, it's never going to work that way. That's why YouTube isn't working, you know? It's like YouTube's great for information, but information applied how, you know?
Yeah.
And like, it's always going to be a matter of not what you know, but like how you know.
Yeah.
Or not what you think, but how you think.
Right.
I don't know. Long story short, though, it is that. It is very much like, you just have to keep trying a bunch of things.
Yeah.
Just keep trying a bunch of things. At least that's how I go about it.
Yeah. And like knowing that there are people that just know a little bit more, and it's okay to ask for help, right? Like I have tons of people that come to me and they're like, I read everything that, you know, I Googled this, I YouTube this, and it's like, okay, let's apply it this way. So you had all the answers. It's just, let me help you like figure out how to put it in a nice little package. And like, that's the same for me. Like if I am having a really hard time, or like my mental health is really bad, like I'm going to somebody else to explore that, a therapist, you know? And I think it's just like we lean on each other, right? Making sure that we go to the right people, which is sometimes hard to understand, but making sure that like we don't do everything on our own, because that just ends up getting people into some like stagnant cycles where they're like, it's not working. Well, it's not working because like you can't do everything yourself.
Yeah, this is also another reason why the Better Together. There's just things that you might not even know. Like you have this idea. I feel like people, and definitely me too, I feel like we have this idea that we, you know, everything that we currently know is the only thing that exists out there.
Yeah.
When there's really infinite ways of doing it.
Mm-hmm.
Like, you kind of get stuck in like, I'm interested in this stuff. And so like, I say, hey, we should do this. And you're just like, I hate doing that stuff. And I'm like, when's the last time you did it? Oh, I've never done it. It just looks dumb. And I'm just sort of like, well, you don't know if you like it until you do it. There's this bit of psychology where it's like you can't put something really into long-term memory until you have like 10 exposures to it. If it's like something that's pretty, like, let's say insignificant, not trauma, like you're gonna remember the car accident the whole time, like from the first time. But I'm talking about something that's like, you know, I like pickles. I have this weird thing about fucking sour pickles, let's say, I don't know, or whatever. And you're like,
do you?
No, I don't.
Oh.
But like, you know, it's like, it almost becomes like an identity. Some people are like, I hate ketchup, I won't eat ketchup. If it has ketchup on it, I won't even get it out of the same room as me, you know? And it's like, have you ever had ketchup? And it was like, you find out it was something like somebody spilled ketchup on them when they were younger, like all over their head, and it caused this weird thing. Any case, long story short, they didn't go to get ketchup, and then one day they eat ketchup and they really like it, but like, they're like, they can't tell anybody because it's like this weird thing in their fucking head that like, no, I'm the person who hates ketchup, so like I can't let anybody know that I actually like it.
It changes your identity.
But you need 10 exposures to this thing. You need 10 exposures to this thing. And so I feel like what's the principle behind this is that you can't, one, try one thing one time, it doesn't work, and then you don't try it again. And two, you can't not do something, try something, you know what I mean? Just because you're just like, I just don't think, I think that's stupid. It's like, well, why don't you just think it's stupid and still do it? You know, like you don't know, maybe. Can
you tell my children this, please?
Yeah, right. Right. That's exactly right. It's this. Have you ever heard this? And I've said this multiple times now, but I think it's a good way to kind of illustrate the point, is that like, have you ever heard somebody say, you just got to make it through the first season?
Yes.
You gotta make it through the first season. You're gonna fucking love this series. You just gotta make it through the first season. And it's like, you just gotta like expose yourself to it enough to be interested in it.
Yeah,
it's
of course.
It's just that.
Absolutely.
It's that with everything. But it's the same thing with like how your body adapts to this shit. It's like, it's not working right now, like, because you only did it once, and it was like for 30 minutes. You've got to do this shit. You gotta like do the shit over and over and over and over and over. And I have this thought that like success is really boring. You know, like success in something is really boring. It's so consistent, it's so monotonous that to some degree, like if you really want to see like the adaptation, like if you're going to change and you know, you tell me to fuck off if I'm wrong, because I'm sure I am. I'm wrong in all these things. But but like if you want to see a real adaptation to your body, you are going to have to do way more than you think in terms of repetitions. The amount of repetitions you need to make a physiological change, and you're not trying to make a physiological change, you're trying to make a fucking change in the way your brain is wired and how it works with your body. One time a week is not going to do it. So you need to kind of just try a million things at 1,000,000 miles an hour, doing a bunch of shit, just keep fucking pushing into it, and get rid of the finish line. And then eventually you'll just be there. Like, not be there. There will be what the process is. The process of trying to get there is like what you're really looking for. Because no matter what you're trying to accomplish, I want this movement impediment to get fixed. I'm trying to get this shoulder. The journey there is really what I think you're really looking for. The hole you're trying to fill, let's say.
Yeah.
When you get to the thing you're chasing, it won't fill the void.
Do I need to put a mirror right here so you could just tell yourself that?
I tell myself that every night.
I'm just kidding.
At night, I'm like, dude,
it's the journey.
It is. It is the journey.
It's like Miley Cyrus, like, it's the climb.
It is the journey. It is the journey, and I will tell you this, like, here's the gig.
Maybe that should be on your shirt next year, like a big old mountain.
What? It was on the last shirt.
Oh, that's weird.
It's kind of funny.
Yeah.
It's on the other side of the mountain. But the thing with me though is that, like, I mean, at the end of the day, I push myself in every single area of my life. I push myself past my capability, so I'm failing in front of everybody like insane. The thing is that, like, fundamentally, I am very happy. You know? Mm-hmm. Like, I am very happy. It's not like suffering and then peace for me. It's peace and suffering. It's like the suffering is the thing that I love because it brings the best out of me. And the best out of me is what I'm looking for, because that's the shit that resonates with me.
Who are you convincing?
In essence, because you're telling me that because you're telling me I need to change the way of thinking.
I'm kidding.
But if you say that, if you say that shit to me, I'm gonna come back, because like, the thing is like, I am a crazy motherfucker. Everyone tells me to thinking too much and everybody does that shit.
But that's you.
But that is me. That is what I'm trying to say. So like, there is no. I'm not saying you have to do this, but like when I'm like out there running for fucking 7.5 hours.
Yeah.
Like I love that shit. That is what I love doing. Not the 130-mile run that I'll do later. Like sure that'll happen. I'll tell you this. I won't be at the. I won't be like at the. If I won first to third, like anywhere first to third, I probably won't spend the time to like go to the podium. I'm not there for that. I did it. Good to go. I'm there for the training.
Yeah.
It's not where I'm trying to get. Like I have this thought of this. Think about it like this. I have this person I want to be in the future. That I'm very clear with. We talk about clear, and I think people could do this too. And let me know what your thoughts are. I'm wrong about all this.
I didn't say that.
But like, look, I have this person who's like a good man, a good husband, a good trainer, a good business owner, a great leader, somebody who's always excited. When you're with me, like, it's like, what the fuck was that? Like that person, right?
Yeah.
This person is like this highest possible virtue. This is the person I'm trying to be. So like what? So I'm always asking myself, what would that person have gone through if I've reached this perfect person? Let's say perfect person, but like, if I reached this perfect person, what would that person have gone through? What would have been the trials? What would have been the challenges they would have put themselves up against to become that person? And in my mind, the things that I do are the things that like people that I admire have done, who like seem to have the characteristics of a good human being that's out here to try to make better, like the place that we live. And so when I'm like doing all this shit, it sucks ass, but that's what I love doing. Because if I wasn't doing that, and I'm telling you right now, it's like, we could live in comfort and kick it, but it doesn't resonate with the soul. Yeah. It's like, I would be worse off. I believe this 100%. I suffocate at the idea of not overloading myself, because overloading myself is fucking exciting. It's like, it's exhilarating. Yeah. There's never any time in between the stuff that people are like, you need to slow down. And I'm just like, no, I don't. I don't need to. I don't need to slow down.
I don't know if you need to slow down or
you know
not.
What I mean?
Yeah.
Because
I don't know. I don't know if you need to slow down or not. But like, you say doing a lot. I in order to be this person, I have to do all these things. Well, aren't you just that person? You are that person. There's no doing to be had. There's just you being.
Right. So
you don't have to do anything to be who you are.
So and there's no doubt, 100%. Like you can just.
He's like, no, not that answer.
Yeah, I don't know if I 100%. I see what you're saying. I just have this, I have all these weird thoughts.
I know, but that's okay.
That's exactly what I'm saying.
But that's who you are. Right. So embrace you. That's who you are.
That's what I'm saying. And so it's
so if you want to go run because you want to run, not because you want to become this person. Run because you enjoy that run. And you want to be that crazy guy that runs 1,000,000 miles. I don't know.
I don't think you can be the guy. I'm telling you, I don't think you can be the guy who runs the 1,000,000 miles unless you just love to run. I'm telling you, because like you wouldn't put in those.
Right?
Miles.
No,
you wouldn't do it.
I agree.
Yeah, you wouldn't do that.
Right? You're running from something or to something, whatever you want to do. But like, if that's who you are, though, you're just like, I am this runner. I love running. This is who I am. Then great, embrace that person, right? Don't run to somewhere.
What if you're also the person who likes to like party and get after it, like throw stuff off the roof?
Ooh, that's a great question. Does it hurt anyone?
No.
Maybe yourself. What are you avoiding?
Pockets. Just your pockets, because you break stuff when you're having a good time.
Yeah, sure, maybe. I don't know. I mean, I don't know.
I'm just kidding.
That's a great question.
Again, we just spin off into all sorts of different fucking
Absolutely.
situations. So, anywho, I got a couple more questions for you. I don't know how long we've been doing it. What's the time?
Forever.
2 hours 15.
Oh my God, we've been getting after it. Oh my God.
Trey's like, we are fucking done already, man.
Okay, I got 2 more questions for you. Okay, last two questions.
Okay,
This one is about ready to live. So you are ready to CrossFit Ready to Live, but Ready to Live Wellness, I believe, is what
Correct.
it's called now.
Yeah.
You guys have an awesome concept over there,
where
there's a bunch of folks getting together, doing stuff, like
Absolutely.
keeping each other aware of each other's stuff.
Yeah.
And I think all you guys are amazing, and I met all of you over the weekend. Like, what is that thing, and how did you become a part of it?
So actually, the two owners, Will and Pete of the CrossFit gym, they were looking at building, and they were just like, hey, what do you, they were looking at buildings, and I met Will through like the old owner of CrossFit South City, Emily, and he was like, let's meet up. And so we met up, and he was like, we have this cool space. You got to come check it out. And I was like, okay, cool. So they bring me to this warehouse. It's dumpy, it's a warehouse. And he was like, and the idea was really cool. He's like, this is where the CrossFit gym is. We're just going to have a warehouse in this like side of it, which ended up being the personal training gym. And then he was also like, upstairs, we're just going to have accountants and like lawyers or real estate agents or somebody to fill that space. And I looked at the guys and I was like, why don't you make it a wellness space? Like, why don't you make it a whole fitness center? You can have your wellness professionals. I didn't say that at the time, but I was just like, you could have a physical therapist, a chiro, a massage therapy upstairs, and then you can have all your workout stuff downstairs. And like they sat on it for about a week. It resonated with them, and they were like, yes, we have to do it. And one of the guys was like, you have to be a part of it. Like, you thought of this idea, like this was all of our ideas, right? And they were just like, you have to be a part of it. And I was like, okay, let me think about it. And like, and then I found the chiro, I found the massage therapist, they found the gym on the other side, and so now there's a CrossFit gym, a personal training gym that's huge, and then a massage therapist who also does breath work and yoga, and then the chiropractor and I. So like we all just kind of came together and decided that we were going to work together to help people.
That's like the fitness house over there.
Yeah.
You guys just have like the fucking
And
fitness
Josh is coming too. Josh is Breath and Exposure STL, and he is going to be also there as well, like April or May, something like that. And he's going to be doing cold plunge. There's also going to be, within the next 6 months to a year, there's going to be a whole spa with like sensory deprivation tanks, cold plunge, sauna, steam room. So it's going to be the full experience.
That's a badass concept. So I'm saying the fitness house. Like I had a conversation a couple weeks. This is what's insane. One, I talked to Will about this on the podcast, and he didn't even explain it like that.
Yeah.
And like he didn't explain it like that to me both times. I talked to him before we had the podcast, and even on the podcast when I asked him what this whole thing was, he still didn't explain it that way. Which I'm like, dude, Will, what the fuck are you doing, man? Explain this amazing idea. But before I had talked to him though, I was talking to somebody about this. They were like, man, I want to have like a place where there's like fitness. You can get like shakes and stuff.
Yeah.
And I was like, yeah, you could call it the fitness house. And then I talked to Will, who is, by the way, which like for some reason it's like, I don't know if it's because I had Josh on the podcast and Will, but I keep calling Will Josh.
Sorry, Will.
In any case, Will, and Will, you should punch me in the jaw for that. You should break my jaw for that. But because I hate doing that. In any case, though, I have him on the podcast.
Yeah.
Somebody who's actually doing that, literally about to open it. I'm gonna have a table I'm registered for a table at the grand opening.
Yeah.
And I go and I learn about the concept while I'm there.
Yeah.
And I asked him all sorts of questions about it.
But you can't. It's really hard, and I think I told you this at the grand opening. It's a cool concept, and most people go, okay, but until you're in that space and until you feel the community that we have and the people running it and just like the energy in the space, it is really, really hard to explain what's going on there because it is something really unique.
It is unique. And there is an energy in there, and it's like an inspiring energy. When I was in there, I was like, I did not expect that.
Everybody wants to be a part of it, and it's kind of cool.
Yeah, that's amazing. Like, this is an idea and a half, like 1,000,000%. And like to your point, it's like there is like, you know how they say like it takes a village.
Yeah,
that's the fitness village.
I know.
Like better together. This is what I've been trying to say. Like this. I don't know, my life. I've been trying to say like why are folks like in fitness, since I've been in fitness, I feel like there is a very competitive kind of like I'm going to be over here, you're going to be over here, like as if there's not like infinite resources out there. If we work together, it's
an abundance mindset, not a scarcity mindset. Your scarcity mindset is these are my people, right? Versus an abundance mindset is like we can lift each other. We all can lift each other.
You're not going to ever there's like an African proverb that goes, alone you can go fast, but together you can go far. And I think that's the case. It's like, you can have your little thing for a while, But if you don't like stop thinking that like everybody's out to get you, like everybody's gonna steal, and that's kind of back to insecurities. That's an insecurity thing.
Yeah.
It's like I'm not gonna like collab with anybody because I don't want to lose my people because they'll think that they're better than me. It's like that kind of sounds like you don't trust your product or your service.
Exactly.
And you get that. But when you go there, I don't feel that out of any of those people. Like all those people really understand, including you, all understand that. I think that's why you guys crush on this podcast. The podcast is about like bringing fitness people together.
Absolutely.
Like, and this podcast goes directly to my clientele. So it's like, why would I be marketing? And all of your links will be in the description below. And I'm just kidding, but literally though, all of your like, I will have a thing that says book a session, and you just go to book the fucking session, and like you'll go there. Like that goes directly to my clients.
Yeah.
And my clients do that, I will be happy as fuck.
Yeah.
You know what I mean?
Yeah.
In my mind, that is where we all win. We actually get fitness to people because we use our voices in fitness, big fitness. Like let's say Planet Fitness, they're making their money on the margin. They're accumulating from you not coming to the gym.
Yes.
That's how big fitness operates.
Yes.
Big fitness operates from you not getting better.
Is it hard to say it that you're actually Big Fitness? Like your logo is Big Fitness and you're calling out
Big Fitness?
Yeah. That's weird.
I may or may not have. That may or may not be the reason.
No, I know you said that, like Big Pharma.
Because the idea is there should not be a negative stigma to big fitness.
Yeah.
But there is, because fitness sells on exploiting your insecurities.
Yeah.
Because they're like, hey, you know how you're like X, Y, or Z? Well, like take this thing and in 30 days you can, and it's like, that's what wins.
Right.
And that's not what's true, and that's what perpetuates all these issues, but that's what wins and buries people like me and you who actually give a fuck about the people. When I say I care about you, this is going to be a process, and I'm here for the journey. It'll be hard, but we'll figure it out together. And I'm here for you in the lows. I'm here for you with the highs. You know, we'll shape your behaviors. We'll get you to where you want to live. You're going to live in like so much of a better quality of life. Like I got you. You know, it's going to be hard, but like if you just, you know, it's going to be expensive, but like, you know, because it is. Because like it's very difficult. Like I have to charge for my service.
Yeah.
But believe me, it's going to be worth it. And you're like, okay, how long, what do you think? What do you think for time? Because I'm just kind of budgeting. Well, it's probably going to be like years of time, maybe 6 months. It's not even really going to do much. It's going to be, you're going to really need to do this for a long time. And then you get, but that's really the journey. It's really for the rest of your life. Then you have Ozempic. And Ozempic says, take this shot for $400, lose 15% of your body weight, guaranteed, in under 30 days with no sacrifice, no effort. Just pay the price. We'll give you the shot.
Right.
It's like, is that really the answer to the thing that you're dealing with? The answer is absolutely no, but we get buried.
But it's going to have side effects, and there's going to be secondary things, and they didn't work for that. So it'll all come out in the end, and that's okay, but that's how people want to do it if they want to do it. But that's the great thing about an abundance mindset is like, here's the thing, that doesn't work for my people, or that doesn't work for me, and I'm not aligned with that, and that's okay. Yeah. And there will be enough people around for them to go, that's not how I want to go through. That's not how I want to like navigate my journey. And we'll be there to help them.
We'll be there to help them. Wait, one more question for you. Hell yeah, dude. You muscle through it. It's getting hot in here. Because I have
so much energy.
Because I have to turn literally, like it's probably literally like 78 degrees because I have to turn the thing off. I heard this before I asked this last question. I asked this question to every guest because I think it's probably one of the most powerful questions you can ask because you'll see. But I've heard this before. It's like, I don't sell to people looking, this is Matt Vincent, by the way. The one great thing that he said over the podcast is, I'm not looking to sell to people that are looking to buy magic. I'm not selling magic. If you're looking for magic, find magic down the street. I don't got magic. And that is real fitness, is not magic. Magic sells, but if you're out there looking for magic, I don't sell magic. So I thought that was good because I'm like, a lot of people trying to buy magic lately.
Yeah.
I'm like, guys, look for not magic. All right, last question. And thank you so much for being on the podcast. This was good fun. I didn't know it was going to. I actually didn't have any clue that it was going to go the direction it went, to be honest.
No one ever does. Yeah, that's the great part.
But I loved it did. So like, If you had the attention of every single beautiful soul on this planet, all 8 billion of them, what would your message be to them right now at this moment?
So Josh asked me and warned me this question. And
You should not. That Josh, motherfucker.
And my immediate response was, fuck bitches, get money. But in all seriousness, I'm sorry I had to do it. Put that on. Fuck bitches, get money.
That's going to be the name of the podcast.
That would not explain all the cool shit we just talked about.
We just got into it. 100%. No, I'm just kidding. Go
what
ahead,
would I tell someone?
If you had that, if every single human on the planet, every human, like right now, we're listening to your voice right now, what would you tell them?
Gosh, this is going to sound so hallmarky. It really will. But I think just accept yourself, right? Like everything will be out there if you just accept yourself. And once you start accepting yourself and you start working through your own issues, things just fall into place. Like the stuff will happen the way they're supposed to happen because you know infinitely that you're just supposed to be who you are.
That's fucking beautiful. Thank you so much for being on the podcast.
Thank you.
That was so much fun.
That was amazing.
Oh my gosh, guys. Well, that's it. There you have it. That is all we got for today. We did a long one.
We did.
What did you think? Did you think we were gonna do two and a half hours?
No.
Oh my gosh. That was good. So guys, thank you so much for jumping in on the podcast, listening all the way. If you made it all the way to this point, you're one of the real ones, and thank you for being one of the real ones. Hell yeah. Where can they find you?
Instagram at Sports Movement PT, sportsmovementpt.com. Those are pretty much the places that people could find me.
All right. Awesome. Dr. Carolyn.
Thank you so much.
Thank you. Guys, thank you for jumping in. Trey, thank you for producing the podcast. Guys, if you want to find all of those links where you can find Carolyn, they're going to be down in the description. Like, subscribe, send this to your mom, send this to your brother, send this to your uncle that you don't really talk to, and the only time you see him is on holidays when he shows up drunk and makes everybody uncomfortable. And we'll see you on the next one. Always remember, think big, live better, folks.
Or
Peace.
feel big.